Okay, welcome everybody. Welcome everybody to tonight's meeting. I'm Mary Ann Pintar. I'm the vice chair of CLERB. Our chair, Ms. Delaney, is not able to join us tonight, so I'll be chairing the meeting. So be patient with me. I'll do my best. We'll start with calling the roll. Pastor Spriggs, can you call the roll, please?
Actually, I'm driving right now. So
okay.
Can someone else call roll for me?
Vice Chair Pintar, Vice Chair Pintar, I can take care of that.
Okay, we'll do it.
Chair Delaney, no. Vice Chair Pintar.
Present.
Pastor Spriggs.
Present.
Dr. Brown. Dr. Brown. Dr. Brown.
Dr. Brown, we're doing a roll call. I think you've unmuted yourself. We just need to a response.
We'll come back to Dr. Brown. Ms. Kinayu.
Present.
Mr. Hayes. Ms. Kink. Mr. Ware. Mr. Ware. Mr. Ware. Can everybody hear me?
I can hear you.
All right. Well, Mr. Ware.
Tim?
He was in the room. I did see him.
Oh, he's there. He's there. Either he's frozen or whatnot. I'm not real certain what's going on. We'll come back to him. And okay. Mr. Wilson. Mr. Wilson is a no. At this point, Dr. Brown, I see your hand is up, which probably means you're here, but I don't know. Dr. Brown. Mr. Ware. Okay, you're here. All right, at this point, it looks like Dr. Brown is calling me, so please allow me to answer that phone call and see if he's having some technical difficulties. At this point, we only have 5 people that have confirmed to be here, I believe. So allow me to answer this phone call. All right, Ms. Hoffman, I have a text and a phone call from Dr. Brown saying he's here, just some technical difficulties. Will that suffice?
What are do you know what the technical difficulty? Can you hear us?
Now let me answer this call again and let me put you on speakerphone here. Let's see. Oh, now I just lost him again. Bear with me. Let me call him back.
So if it's helpful, I just received a message.
Okay.
Hold on.
Suggesting that maybe Zoom had an update today, and that might affect the audio. So if you need to update your Zoom to get audio, but we can hear you now, Dr. Brown. Mr. Ware, can you hear us? Okay. Mr. Ware, can you hear us?
Enter your participant ID followed by pound. It might be. Otherwise, just press pound to continue.
Okay, I have Dr. Brown on the call, and he can hear us this way if I keep him on speakerphone.
Okay.
Dr. Brown, can you acknowledge that you're here?
Yeah, I'm here. I can hear you.
All right, there we go. So Dr. Brown is here, and I guess I'll just keep him on speakerphone until he can remedy the situation. Mr. Ware.
You have joined the meeting as an attendee and will be muted throughout the meeting.
3, 2. I'm trying to count 1, 2, 3, 4.
You had 6.
I think I have enough without Mr. Ware acknowledging that he's present, correct, to proceed? and he just waved. Is that a good enough acknowledgement, Sheree?
You can hear us, that it's fine. You can hear us? Okay.
Okay. All right. With roll call completed, Paul, correct?
Yes, ma'am.
Okay, we'll
No.
move on to public comment.
I
This is an
didn't-
opportunity.
Oh, wait, I apologize. Miss Mondragon, Federico Mondragon.
Present.
Sorry.
My apologies. I somehow counted you, but all right, I think now we're good to go. My apologies.
Okay.
So public comment, let's see if we have better look at this. So
With-
Vice Chair Pintar, I have 3 requests to speak, and then one person has actually 2 more have requested to speak. May I go to them?
Please do.
All right. At this point, let's Debbie Eschbach. Debbie Eschbach.
Yes, can you hear me?
We can hear you just fine. Your 3 minutes to address the CLERB starts now.
Thank you. First, I wanted to thank the CLERB for the work that it does. I've been attending these meetings for the past year, and I'm here to comment on case 21114, the death of my brother while in custody. My brother caught COVID-19 while at George Bailey. He was there for less than a month. The day before he was to go to court, somehow he fell out of his bunk, ended up being rushed to an outside hospital. Our family was not told for over a week that he was in the hospital, and we were called after he was actually put on a ventilator. No family member was able to speak to him or see him while he was in the hospital. And, we should have been able to communicate with him. He was all alone and had no idea that we had asked to see him or to speak to him. He was there for 3 more weeks before having a heart attack and then going on life support. We were then contacted to be able to see him, and it was too late for him to hear us, being brain dead. Seeing him lifeless on multiple machines with his eyes wide open was really not the last way I wanted to see my brother. His death was 100% preventable. I mean, the lack of a safe environment and prompt medical care at George Bailey is ultimately what caused his death, and the facility should be held accountable for those deaths that continue to occur, and they're continuing to occur. I don't agree that his death should be classified as natural causes, and I know that this topic has been brought up before by others in this meeting. I mean, natural causes does not throw up any red flags in the prison system. So those deaths, the prison deaths, don't really get counted as an accidental or even a homicide, if you will. I mean, it's hard to wrap your head around it being a natural cause. He caught COVID because of the unsafe environment he was in. He had no control over protecting himself from several other inmates who had COVID. And, those that contribute to his death really should be held accountable. Thank you. You're muted.
Thank you, and my condolences, Ms. Eschbach. Next, we will go to Lisa C. Lisa C, am I saying that right?
Can you hear me?
We can hear you. Your time starts now.
All right, hello, and thank you for having this meeting. I was invited to this meeting. My appearance is in regards to my son, Jacob Christensen, who has been held at the downtown county detention facility for almost 7 months now. Basically, I had called CLERB because my son had wrote me a letter stating the injuries that he had absorbed when he was there, which he still is there, and also that he had taken something, I'm not sure what it was, but it was detailed in the letter that he sent me. I did open a complaint with CLERB. Will Graham was the investigator at the time. However, he did leave CLERB because he did not feel that CLERB was acting on behalf of what they stand for. Basically what happened is that my son had taken something. He had notified the officers that he was in severe pain. It had to do with his penis, pardon me. And he couldn't pee, he couldn't do anything, and he was in so much pain. It took them 3 days to get him to Hillcrest Medical Emergency, where they had to do emergency surgery and operation, and he almost lost his life. And the physicians at the facility did state that this was totally unnecessary, that the medical staff at the downtown facility should have known better. That is a complaint. There's like 5 different things on the complaint list. And that happened when he was in the hospital for 5 days. When he came back, all of his belongings, all his commissary, all his letters from his attorney, everything was gone. Not to mention that his the inmate next to him had been found in his cell dead. And so there was a riot that went on at that time. He was put in the hole for constantly saying that he needed medical attention, and they refused him medical attention. Prior to this, which is a big deal, which I am going to enlist a private attorney for that, because he's still having problems to this day. Prior to that, he had an infection in his leg and wanted to go to medical, and he put in so many medical requests. And when he went there, finally, all they gave him was aspirin. You know that when you have a staph infection, that you have to have antibiotics to clear that up. So that happened before that he was taken into the emergency room, but it took them 3 days. And when they finally took him to medical, even the medical staff said, oh my God, we need to transport him to the emergency room at Hillcrest. So that is the first complaint, that they denied him medical attention. They didn't even take him to the medical staff at the facility. It took him 3 days, and then there were no medical request slips. And so because he kept throwing a fit and keeps bothering them, they put him in the.
Thank you, Ms. Christensen. Next, we will go to Darwin Fishman. Dr. Fishman.
Thank you. Good evening. Really powerful testimony that you're hearing from families. I'm sorry that you cut it off. I'm really glad that the family members are calling in that have lost loved ones. And I'm hoping that will help to motivate you guys to do your job for holding law enforcement accountable for the way they run the jails. And I hope that at some point, if it's really out of control, like we're in now, we're reaching these new records for deaths, and we've gone over the previous record from last year, that at some point you will help elected officials with saying that it's completely out of control and that it's time for some type of state intervention or national intervention, that San Diego actually can't get it right. What you're doing, what the supervisors are doing is clearly not enough. There's still more people dying. And I don't know how many more people need to die, how many more family members need to come here and give testimony about how they lost loved ones, and they're receiving things like aspirin for staph infections, where you finally drives home the point that it's not working. Sheriff's Department is just not capable of running these jails, and it needs to be taken over by some other entity. I don't know at what point you think maybe 2 deaths a month, 3 deaths a month, where it's finally recognizable to you and the other entities that are responsible for the Sheriff's Department and how these jails are run, that it's just not working and you're completely failing. Thank you.
Thank you. And to be clear, obviously, all public comment is 3 minutes. And if I could have members of families talk for more than that, I would, but it's 3 minutes. And unfortunately, that's the rule. So I apologize for that. But next we will move on to Mr. Miller. Mr. Miller. Mr. Miller, are you there?
Yes, I am. Thank you. Can you hear me?
We can. Your 3 minutes starts now.
Great. We're extremely disappointed at breaking the record this year of number 19, Mr. Vogelman, who lost his life in custody. And some people may try to dismiss it as, okay, it was a fight between inmates and the Sheriff's Department is not responsible for these fights. But of course they are. They're responsible for every life in the jail. And the questions that we have to follow on, it actually comes from the auditor's report. Were there intercoms available so that the people can call for help? Were they working in the section where the inmate was injured? Were there videos available in to watch and monitor what was going on, to probably intervene at a time where it could have saved Mr. Vogelman's life. So there's a lot of issues that go beyond just a simple fight or a riot between inmates. And I'm so glad to hear all of the family members here asking for help and talking about their complaints in their reports. Hopefully the family members will reach out to the North County Equity and Justice Coalition so that we can bond together and make a unified stand for the rights of these people who have lost their lives in custody, and make these complaints a system where we can get some results out of it that the families will be satisfied with in preventing these kind of issues for other families coming up. We have a family member who has her daughter was in a crisis of withdrawal, and she was begging for help, just like one of the earlier callers, begging for help, and no one would help her until she was in a crisis, so much of a crisis that she had to be sent to the hospital. And once she was rendered the care, sent to the hospital, she was saved from being another Elisa Serna. And Miss Ruby Ross is one of those people who avoided this in custody death, but it wasn't from the great mercy of the jails. It was from a neglect of the person. So like the earlier person said, that these natural causes need to really be looked into detail, and these issues need to look into detail. Were they neglect, or were they something else that couldn't be helped? And if it was neglect, someone needs to be held accountable. Thank you.
Thank you, Mr. Miller. Next, we will go to Ms. Maxwell. Ms. Maxwell, are you there?
Yes, can you hear me?
Yes, ma'am. Your 3 minutes.
Great, thank you so much. Francine Maxwell, Southeastern San Diego resident. I'm concerned that the CLERB hasn't held a retreat for the community. We appreciate people that volunteer on boards and commissions, but there's a true disconnect between, we've been on webinars and Zooms, and there's nothing like being in person. Of course, civility is very important, but we need to come in person at the top of the 2023 to have a retreat with CLERB so that we can truly understand your charge. We can have presentations. You can have the community bring their own lunch. Just get us a building that we can socially distance in their space with some audio. This is getting just a little bit ridiculous that people are charged to do something, and we truly, as a community, there's some lack of trust. We need to begin to build trust. We can't do that until we come together under one roof. So please consider having a community retreat and a training so that we can start off our 2023 a little bit different. We know that we send condolences to the family, and we also need to pray for the future families, because we know that this is going to happen again. Thank you for your consideration.
Thank you, Ms. Maxwell. Next, we will go to Natalie. Natalie, are you there?
Yes, can you hear me?
Yes, we can. Your 3 minutes starts now.
Thank you, CLERB. My name is Dalina Shot. I'm from zip code 92131. My pronouns are she, her, hers. Today, I wanted to echo what some of our community members have already spoke to, and those powerful testimonies bring to the forefront. We've lost another life, another family member, friend, and community member with Mr. Vogelman. As you know, we've surpassed last year's losses, 19. The LA Times recently reported that San Diego holds the highest jail mortality rate in California's largest counties, and it has for 10 years. The article in the LA Times also is noting that the Sheriff's Department says it's doing its best, but that nothing has worked to bring improvement. My question is, for the last 10 years, they've been doing their best with no improvement. The Sheriff's Department has been unable to make any improvements over this extended course of time. I think that highlights the brokenness of the system and those upholding it. Previously, it was proposed to CLERB that the Attorney General step in to oversee detention centers, given the severe crisis conditions and record deaths in San Diego County jails going on. So to me, a record loss of life and family members, community members, and having that occur at an accelerating rate is not going to invoke CLERB to call for significant systemic change with the Sheriff's Department and the entities that oversee detention centers in San Diego County jails. I'm losing faith in what will call CLERB to such action. I'd also like to echo the idea around or call for CLERB supporting state intervention at this point. Thank you for your time.
Thank you, Natalie. Next, we will go to Robin Sales. Bear with me for 1 second. Ms. Sales, are you there?
Yes, can you hear me?
We can, and your time starts now.
Okay, somehow I lost the video, but I'll speak anyway. So my name is Robin Sales. You know, I've been coming to these meetings for a very long time now. And I'm here to talk about the way that we see people who are have been incarcerated. I represent Showing Up for Racial Justice, North County, San Diego, and I'm also a member of the Behavioral Health Advisory Board for District 3, and I'm speaking for myself and my organization. I appreciate how difficult it is for you to evaluate so much material and to come up with a decision on a case. Most times you probably don't have a sense of who that person is as a human being. Of course, you could look at them as, quote, another criminal and forget that this person could be your family member or close friend. As we now have had 19 or 20 deaths in sheriff's custody and one for the San Diego Police Department, which will be reviewed by the Sheriff's Department, I wonder if the secondary trauma of delving into these cases with little power to execute change has left some of you burnt out. Is it impacting your impartiality? I truly hope that you consider the pain and suffering of the families who need you to do the best job you can. I highly recommend reading His Name is George Floyd. It's a new book, which shows how poverty, racism, lack of opportunities, coupled with police bias and over-policing led to Mr. Floyd's callous death at the hands of the Minneapolis police. So I really implore you to have your own self-care so that when you look at these cases, you remember that it could be one of your family members. Thank you.
Thank you, Ms. Sales. Next, we will go to a Zoom user. Zoom user, could you please identify yourself and then your 3 minutes will start. Zoom user.
Looks like they might still be muted. Paul, is that something you need to do? Unmute them or themselves?
It's up to them. Yes, I've given them permission to talk. Just don't. I see that they're still muted. Let me see if I can unmute them. Ask them to unmute. Okay. At this point, I'm going to go away from that person and then we'll go to, I thought I saw a hand from Brittany Eschbach. Brittany Eschbach, are you there?
Hello.
Hi, we can hear you. Your 3 minutes starts now, Ms. Eschbach.
Hi. I'm Sophie, my dad Richard's youngest daughter, and I just wanted to talk about the injustice I feel like my dad faced while being in George Bailey's. While he was there, he would call me and tell me how dirty the jail was and what an unfit place it was to be there. He would even tell me that they wouldn't feed him 3 times a day and that he was starving. And hearing this from my dad and not being able to do anything was really heartbreaking. My dad's court date was supposed to be on October 19th, the day before my birthday, but instead he was sent to the hospital and I had no idea until a week after, and by that point it was too late for my dad. And I could only see him once he had already passed in the hospital. And I truly feel like his death could have been prevented if he was never sent to George Bailey's and he would still be here. with us, and I don't think he should have ever passed away. And I do want someone to be held accountable for his death. Thank you so much for listening.
Thank you.
That's it.
Thank you, Sophie, and our condolences, obviously, on the death of your father. At this point, I don't see any other requests to speak. However, I do have a request to read a comment into the record. It comes from Karen Remus. Good evening, CLERB members. My name is Karen Remus. I live in zip code 92131, and my pronouns are she, her, and hers. On October 6th, the San Diego Union Tribune reported on the 19th in custody death in San Diego County this year. The story went on to explain that the Sheriff's Department has now exceeded last year's total number of deaths, and there are still nearly 3 months remaining in the calendar year. CLERB members, tonight I remind you that every single person who has died in custody was someone's child. As you respond to this and the previous in custody deaths, I ask you to act with the outrage, intention, and motivation that you would demonstrate if the person who had died in custody was your child. Thank you. So with that, Vice Chair Pintar, I turn it back over to you.
Thank you, Paul, and thank you to the members of the public who spoke tonight. All of our condolences. I'm sure I speak for the board, for those family members who spoke. Thank you for coming to talk to us tonight. Item number 3 is approval of the minutes. Do I have someone who would like to make a motion to approve the minutes? I was not here, so I am going to abstain from this.
So moved.
That was
Brown, Dr. Brown.
Dr. Brown. Thank you. And do I have a second? Dr. Brown made a motion to approve the minutes, and I'm looking for someone to second the motion.
This is Pastor Spriggs. I second the motion.
Okay, second by Pastor Spriggs. Thank you very much. Paul, do you want to call the roll?
Are these both minutes we're talking about? There are 2 minutes.
There's 2 attachments, A1 and A2. I assumed it was for both, but does anyone have questions or have any reason to separate the 2? Cherie, are we allowed to take them together?
Yes.
Yes.
Okay.
Yes.
Okay.
All right, very well. So it's for both, and I'll start with Vice Chair Pintar.
I'm going to abstain. I was not here.
Pastor Spriggs. Pastor Spriggs.
Yes.
Dr. Brown.
Yes.
Ms. Kinayoub.
Yes.
Ms. Federico Mondragon.
Yes.
Mr. Ware.
Abstain, I was not here.
The motion does not carry. Only 4 votes for yes, and 6 is required. So
Ms. Hoffman, are we allowed to vote on the minutes if we were not here?
I was going to say, if you familiarize yourself with the proceedings of that meeting, you can vote for the minutes.
I did read them, but I didn't have any way to verify them since I was not present. But if we're allowed to, I'm happy to vote if you want to call the roll again, Paul. Mr. Parker?
All right, very well. Vice Chair Pintar.
Yes.
Pastor Spriggs. Pastor Spriggs. Dr. Brown.
Yes.
Ms.
Sorry, yes for me, Pastor Spriggs. I'm sorry.
Pastor Spriggs is a yes. Ms. Kinayoub.
Yes.
Ms. Federico Mondragon.
Yes.
Mr. Ware.
Yes.
Vote passes. The vote carries.
The vote carries. Okay, thank you very much. We'll move on to item number 4, presentations and training. The first item A is justice involved care coordination. Presentation by Dr. Sion. I'm going to try. Thialalapavan.
Close. Thank you, Vice Chair.
T.
And thank you, Paul Parker and CLERB and really the whole public audience who's listening in for this opportunity. I'll go ahead and start if it's okay. I'm going to share my screen. Okay. And hopefully you could see that. My name is Dr. Seonthi Hiloli Pabin. I'm a public health medical officer within Health and Human Services Agency, and I work specifically on both justice-involved health as well as harm reduction. I will say that this presentation was really a recommendation when we checked in. We've been working on responses to this board letter, and we've been some of the folks, some of my colleagues who gave public comment actually heard a version of this presentation, but at their recommendation, really in Behavioral Health Advisory Board, we did go back to our Office of Equity and Racial Justice and really talk about at the county CAO's office and talk to them about really how should we integrate community more into this, are there other groups that we're not presenting to, and they strongly recommended that we run this by you. And so just so you know the context, and so at the recommendation of Office of Equity and Racial Justice at the county level, I'm here to hopefully try to do that. And so you'll see in front of you the name and the title. It's really an overview of this May 10th board letter, and it has this really long Latin name, and I think this is probably a record for how many words you could fit into a title slide. Supporting care coordination for justice-involved individuals through funding and integrated data infrastructure. So I'll be talking about that, but really the goal is to try to just give you situational awareness about this effort, what we're doing, and see if you have any feedback or thoughts as we continue. Right now, as you'll see, we're mainly in kind of the internal fact-finding type of phase, but as we proceed, we're going to try to bring in external folks more, and we've started to do that, as I'll talk about. Okay. And then I have, and I do want to acknowledge Sarah Gordon from Public Safety Group Executive Office, Group Program Manager, is here with me to help answer questions if needed. Okay, so this I don't have to tell you. I think it's clear from a lot of the dialogue you've already had in this meeting that we know, that anyone who is incarcerated, generally speaking, has significant health barriers or disparities already compared to much of the general population. Probably no surprise. And then there are also documented, consequences of being in a carceral system. And so all of that said and done, we know that further improving care coordination, data exchange, where possible, can really help, or hopefully help, create a structure and make it hopefully seamless, to share available data. Of course, there's a lot of rules, there's a lot of regulations behind a lot of this data. So this is something we have to explore carefully, but we do want to explore. And so there's a lot of work that was already being done, not just in the county, but at the state and federal level around this type of data sharing, et cetera. And this is more recently, I just wanted to highlight a few things. So last year in July, the governor had signed AB 133, which had a couple different things written in it, but one of the main things was really to help facilitate this data exchange across silos. And one specific area that continues to be kind of shown in some of the subsequent examples is justice-involved data exchange and some of the barriers there. And this is also to help aid the implementation of what's called CalAIM, or the transformational effort that's happening in our state Medicaid system right now. Sorry. And then in October, as you may have heard, the board approved action to pursue a data-driven approach to public safety and identify service gaps across the delivery system. This is what some of you may know as the Alternatives to Incarceration effort. And then in July, the Community Correction Partnership Plan, the CCP plan, even also prioritized and mentioned data integration efforts being a priority, right, between justice partners and Health and Human Services Agency. And then in this February, and in one of the report backs to the board from the Alternatives to Incarceration board letter, there were identified challenges in coordinating care across health, justice, and social service sectors without better data integration and better infrastructure for that particularly. So that led to District 3 really taking a lead and crafting a board letter that was unanimously passed in May that had 4 different recommendations. So I'll go through them quickly. One was to report back in 180 days with a proposed data management structure related to recommendation 2. I kind of find these recommendations a little out of order because recommendation 2, in my opinion, is the bulk of it and probably should be first. And then report back in 90 days to provide a baseline status on our efforts to date. And so we've already passed that 90 days. We have a 90-day memo that's public. I'm more than happy to share a PDF of this and the 90-day report back if you want to see, but this is kind of a visual representation of the 90-day report back as I'll get to. And so recommendation 2, which is the biggest recommendation, is really to direct the county staff to, and via the CAO, to develop a proposal and plan to advance data management and governance integration, county programmatic data sharing, and then also being able to look and explore tapping into these regional community information exchanges and the health information exchange, and then come back with a report that talks about opportunities and challenges that are not including but not limited to policy, funding, legal, compliance, and regulation and infrastructure. So this is quite a massive project, as you could see, and one that frankly will take years. But they did say in recommendation 2 that we should be looking across client data across the continuum of care and the sequential intercept model, which probably many of you are more familiar than even I am. So as you see here is a visualization of the sequential intercept model. Recommendation 3 also encouraged us to pursue funding opportunities to support healthcare and social service data interoperability and integration efforts for data for this population, justice small population. And one example of that is the county, we did apply for and receive CalAIM PATH funding, which is providing access and transforming health, their justice involved capacity building round 1 funding. So that we just received recently, that allows us to have some funding to work to explore how to connect our social services, the group that turns on and off Medi-Cal, with our justice involved partners in the detention facilities, because by next year, what you may or may not know is the AB 133 requires that process to be in place. The good news is our county is actually one of the good example counties that the state uses when they talk about how counties are doing, and we already have that in place to a degree. We're just looking how to scale that up internally in the county. And then of course there's going to be a PATH round 2 funding, which is much greater, and that allows you, round 1 really funding really allows you to explore what opportunities we should be looking at and where are the barriers, so that way you can apply for round 2 to actually help you address those barriers. And then recommendation 4 is to just provide routine status updates every 180 days. We did, I'm sorry, I'll get back to that. And then, the recommendations ask the county to take an initial step towards data integration and improve management. And you see it really ranges, and it really talks about all of these different types of stakeholders that are going to be critical, including community, including public safety, including health and human services providers and CBOs, and then information exchanges, right? And then I'm sure plenty others that I'm probably not leaving out for right now, like the courts, for example, or the public defender, et cetera. So, so it really talks about first going through and identifying where the challenges are, where are we right now? And so this is a timeline that you can see for our project so far. We did go back, and since those dates that you saw earlier, we did go back and request some extensions, at which the board was fine with, just because they know that we are progressing. But this is quite a feat, as you know. And so May 10th was when the board action was approved. The 90-day memo was submitted on August 19th. This is around October-ish is where we are now. And then we have these other dates that are coming up. But what I wanted to highlight in this project timeline is that even if dates are pushed back, we are still working collaboratively across the county on this. And this is probably a better visualization for me, at least, to show you kind of what we're doing and how we're doing it. And so what we're trying to do first is really just, figure out where are we? What is the as-is state, right? What are we doing looking at within the county, but then also outside of the county? And in terms of what justice-involved data sources do we have? What agreements do we have within the county to share those data? What are the rules and regulations, et cetera? And so this is the framework in which we're kind of tackling this challenge. And so you can see here, the blue boxes will help us figure out, where we are as a county and overall county, right? And we have to start somewhere. And so we've had these groups like County Data Sources Group. We just kicked off. We had a big meeting last week of non-county data sources groups, right? And that included a lot of our non-county partners into that group. And then we've also been having a data governance, privacy regulations, data sharing group, et cetera. And so at the end of these blue boxes, we are going to come back to the board with kind of a summary of what we found, and then based on what we found, what are some of the gaps? And so when we start talking about gaps is when we will need to increasingly depend on some of the, the subject matter experts. And some of that are different people than the people in our current conversation who might be a little bit more data oriented or regulation oriented, et cetera, but maybe some of the more people on the ground, for example, working, on terms of how does care coordination, what are the gaps, what are they not able to get data-wise to help them do their job more effectively and help improve the customer service, if you will, of those justice involved. And so the next phase is this green future state where we'll be having those types of conversations, right? And we like to, bring it back to certain groups like this one, but then also we want to involve justice involved in individuals with either people working with individuals or people with lived experience to help inform some of this, of course. And then we do have a few additional projects we also want to do and have started to do, which is, like I mentioned, the funding opportunities, looking at other external partners, and then also a scan of what other counties are doing. We also put private sector, but to me, what other governmental entities is as important. And then hopefully we'll also look for private sector too. So that's in a very quick nutshell, really what we're doing or trying to do with this very, very immense project that you see. And I'll say that, we're not necessarily waiting for this whole project to finish before taking action. There are some things that we've identified that we, will try to work on, of course, as we go on. And there are other efforts like alternatives to incarceration that are also identifying some key gaps in terms of data sharing. And this data sharing could be for care coordination. It could be for strategic planning, right? Where we figure out where do we put our resources as a county, for example, right? Where do we open up another X, right? XYZ. So things like that. So, or it could be for program evaluation, right? See, how are we doing? How do we, we're putting all these resources collectively, whether it's county or non-county, and how does that affect our population? So it's for multiple purposes, of course, and there may be different data sharing rules or regulations that apply based on why you need it. For example, clinical data sharing for clinical purposes is generally, more okay by the regulations and more permissible because it's, from clinical provider to provider. So for patient care is different than, individual data, maybe for other purposes. But so that's an overview. I will stop there and ask you all if you have any questions. And invite Sarah.
Thank you. Thank you. Thank you, Dr. T. I think we're going to go to questions from members of the public first, and then we'll come back to board questions. Paul?
Very well. I will, Miss Maxwell. Miss Maxwell, are you there?
Yes, can you hear me?
Yes.
Can.
Thank you so much. I'm confused as to why CLERB needs to be involved with 6, 7-figure people when we have the data that you need to be absorbing and making sure that your whole time, your whole being is about the people that are dying in custody. You're playing with race and equity data, people making 6 and 7 figures of our tax dollars. You're going to let them distract you from our justice involved. Care, we know that they're not getting care. The data shows you. The sheriffs that are overworked, the data shows you how many of them are overworked. How much time do they get to go rest? How much time do they get to have with their families because they're not taking care of our incarcerated brothers and sisters? Come on, people, as we wrap up the end of the year, you're going to let them give you something that's going to take 5 years strategic planning, and we have in custody deaths right now. This is appalling to hear tonight from this department. Thank you, Paul.
Thank you. Next, we will go to Mr. Miller. Mr. Miller, are you there?
Yes, I am. Can you hear me?
Yes.
We can.
The two concepts that I think we need to not double, but triple and quadruple our efforts in is the CPP aspect of the community connections. I think it needs to be a far more robust than what we were planning on. And this community connection should definitely involve in impacted family members. There are impacted family members who are with mental health issues. There are impacted family members with homelessness issues, and there's impacted family members with addiction issues. And the outreach and connection between CPP and groups like the behavioral health, the bridge between these two need to be really solid and intentional. Otherwise, it's just window dressing, and it's not what we need. As Ms. Maxwell just said, that we have people dying from these kinds of groups and categories. And the alternatives to incarceration, which was also mentioned, we realize that mental health, addiction, and homelessness being criminalized gives us more contact with law enforcement, and the incarceration rate of the addicted and mental health and homelessness they're all intertwined. When you think of one, you have to think of the other. So these community connections and this alternatives to incarceration is very, very important. We have misclassified people to the extent that they have died in custody when they should have been in the mental health facility, or they should have been in a homeless outreach program, or they should have been in a drug addiction program, and they withdraw in jail. They wind up losing their lives. And then here we are with more families complaining at CLERB. So I think we need to, like I said, quadruple and redouble that in our efforts to make sure that these programs are robust. Thank you.
Thank you.
All right, thank you, Mr. Miller. Next, we will go to Gilbert Gill's daughter, Jennifer Schmidt, I believe. Jennifer, are you there?
Hi, can you guys hear me?
We can hear you. Your time starts now.
It's not just like she was saying, it's like appalling. My dad, as of in 3 days, will be gone 8 months, and I still haven't received even an autopsy report. And it's just absolutely ridiculous how my dad should have never been there. He had dementia, was well aware of that, put him in jail, saying he was under the influence twice in 24 hours, and he died. He died 15 hours after being booked into Vista jail. And the second autopsy said it was completely preventable. And it's just, we're getting no answers. And when I did talk to the medical examiner a couple of weeks ago, she had the audacity to be rude to me, like I was bothering her. And it's just, none of this matters, all this statistics, none of it matters. Something has to change today. 19 people, that is absolutely disgusting. If it was your family, Mr. Parker, or your dad, or any of you guys, would anything change? Would you put a sense of urgency into it to make it change faster? I think you would, because these are dads, these are brothers and sisters, and it changes it changes everything in our life. And I just think that none of this data matters if we're not doing anything right now for it. That's it. Thank you.
Thank you. Next, we will go to Robin Sales. Ms. Sales?
Yes, hi. Hi, Dr. Sayon, how are you? So my concern really, and I've said this many times, is that the sheriff's department is like a rogue agency. They do things and they give data to who they feel like giving data to. They respond to the CLERB partially or drag their feet. And by the time you get the information from the sheriff's department or on the policies, they're usually, I know it's about a 50% rate of changing their policies. I think that's what Paul has said in the past. And so my concern is, what if the sheriff's department refuses to cooperate? I mean, I respect what the ATI group is doing, and being on the Behavioral Health Advisory Board, I know what we're doing, but a lot of it rests on the sheriff's department. It's pivotal information, and we're not getting it. And that to me is very frustrating, and more people are dying. So, you know, Dr. S, I know it's really, you're in the sort of in the middle here, but I would implore you to get the public safety group, Sarah, I'm going to address that to you as well, is get the public safety group to really work on that, for the sheriffs to be more collaborative and transparent. And I don't think any of us can do our work in the communities, like Ms. Maxwell said, and like Mr. Miller and Dr. Fishman. How can you do your work without having the data that you need? So my fear is you're going to go through this whole process of the ATI, and then it's just going to be on a shelf and nobody's going to pay attention to what it comes up with. Thank you.
Thank you, Ms. Sales. Next, we will go to Lisa Christensen. Ms. Christensen, are you there?
Yes, I would just like to say that I agree with the majority of the public people that have come to speak with this committee. I mean, I had never even heard of CLERB, but when my son wrote to me and said, Mom, you need to get a hold of CLERB, I was actually ecstatic that, oh my God, there's some checks and balances to hold the sheriff's department and probation department accountable. However, that was 7 months ago. You know, nobody, Will, that did work as an investigator for CLERB, went saw my son once, he left CLERB for what I said before, and nothing has been done. He did give me Paul Parker's email address to email him, and hopefully maybe something could be started, because there's like 7 complaints given to CLERB. I have a whole open format addressing with documentation and everything, and nothing has been done. And it's just like, we come to these meetings and we address our concern about people that we love or that are in custody. You know, they have rights. They're still human beings regardless, until they're found innocent or whatever. And I just feel like when they can't even get a shower, when my son has to be stuck in the hole for trying to get medical assistance, but there's no more request, and then he's not even seen, and then he's thrown in the hole and not even given a shower for 5 days. I mean, and plus them not giving him medical attention when he almost died. What is CLERB's position? Is it not your job to go into the facility and start asking questions? Somebody has to be held accountable. Because I'll tell you what, I know for a fact, if it was you guys as kids, or your mom or your dad or somebody like that, I mean, yeah, they're in jail, but you know what, in this society, you're guilty until proven innocent. And by the way, he does need to be in some place other than jail, like a mental institution, because he has problems. So instead of addressing those problems, what do? They throw him in the hole, shut him away, and then he doesn't get seen to where he almost loses his life. He's 22 years old. You know, he has a whole future in front of him, the way this country's going. If we can't even go to CLERB, who's supposed to be the person that's an intercessor for human rights, for God's sakes, and for people that are incarcerated that don't have a voice. And God forbid if we didn't have parents or us that come to you, who knows? But this is 2022, for God's sakes. Can you guys just get on your job, please? Because people are dying in there and they're not being treated like human beings, and it's scary. Thank you.
Thank you, Ms. Christensen. Next, we will go to Dr. Fishman. Dr. Fishman, are you there?
Yes, thank you. Good evening. I just wanted to add to what Robin shared, put a fine point on it, because Dr. T, I've also heard you speak BHAB and other places. And I think it's also be good for CLERB's benefit to share this too, which is Robin brought the part about the sheriff's department. We already know they don't share data. In fact, they're not legally obligated to share anything. I mean, in the sense that they can say potentially no to anything. So what I'm curious, and this connects also to Francine's first speaker, which is I'm really worried that at the end of the day, like this, at a theoretical level, the data sounds great and being able to collect it, but that we really actually won't be able to accomplish the goals that we need. And the sense that the data that would be most useful, whether it's CLERB, BHAB, or where I am in ATI now, we'll never be able to get access to the data that will make the biggest difference. And that's the part I think that needs to be shared, loudly from the, scream from the rooftop. So, for example, if someone like with a mental health crisis, if they're arrested, I don't know if we'll ever get the information we need from law enforcement about the arrest record, how many times, what crimes they're arrested for, and also the information from BHAB about, is it mental health? Is it just homelessness? Is it drug addiction? So that there'll be some overall picture of what entities, state entities, and agencies are dealing with this person, and who's dropping the ball, who's failing, how much of it is law enforcement is not doing what they need to do, how much of it is the social services are not adequately treating this person, and they're not staying at an institution, a place they need, and that will still be back at square one. I don't know necessarily, quote unquote, just sharing data solves that, unless it's really targeted and clear on where we're getting the data from and how it's going to be used to actually help people. If it's going to be used to keep the status quo and law enforcement being first responders for mental health crises, that doesn't serve us well. If there's actually a goal and agenda for improving and getting us out of the status quo, improving people dying in terms of dealing with law enforcement mental health crises, in terms of data for people that are in jails, incarcerated, and dying in custody and getting better treatment, then the data collection doesn't necessarily mean much at all. So that's the concern. And I hope in your presentations you begin to articulate that. What's the point of this data collection and sharing if it's not to help get us out of where we're stuck in right now? Thanks.
Thank you. Next, we will go to Mills. Mills?
Yes, I'm calling in regards to the mental health. My brother Kevin died in November 2022. He clearly went to the judge, and the judge seen that told them that he was unfit to stand trial, and that if they didn't get him into immediately help, he would die. And they were supposed to transfer him to Patton, which is a mental hospital. And Kevin has already had been spent time in Patton. And my thing is, one doctor went and seen him, and they said that they couldn't find him due to his birthday, a wrong birthday. But they was able to call us and let us know that he passed away. But the doctor who came, just because of the wrong birthday, they couldn't find him. So this data you guys are talking about, he had record. He had a record there. So how couldn't they find him? Why didn't they send him to Patton? And just like what the lady said, what who just said, if you don't get him the proper help, he's gonna end up like my brother. And my brother did not need to die, because clearly the judge said Kevin needed to be moved to a mental institute or he would die, and he died in San Diego County Jail. So it has to be, like she said, transparency, and something has to be done. And it's this unbelievable. You guys keep saying data. If somebody already been in jail and a doctor comes to see you, and you're clearly under there with his name, but you can't find him with his birthday, but he's already been there before, and you already knew he had mental issues and he was having a mental breakdown, and nothing, and he didn't get transferred the way that the judge insisted that he get transferred. So that's all I have to say. I'm like the lady. It's mental health and medical. Something needs to be done. That's all I have to say.
Thank you, Ms. Mills, and my condolences on the loss of Kevin. At this point, Vice Chair Pintar, no further public comment. Or public, no further comment.
Yep, I will go to board questions and comments. I believe I saw Mr. Ware's hand raised first. Mr. Ware?
Good evening, board members. Dr. Seon, good evening. Thank you, first of all, for all the great work and passion and knowledge and leadership you gave this county and continue to give this county during COVID, man. I really appreciate partnering with you and being able to depend on you. I think my statement or my questions have been answered by members of the public already, but I really want to bring up, because they brought up a lot of good questions, the data that we're talking about. Are we going to be able to tell, or do we have information on, you mentioned earlier, the rates for individuals who are incarcerated? Is it physical or from a behavioral health standpoint? Do we have that data to tell which is more, so we can determine where we need to go with support and resources?
So thank you so much, Tim, and also members of the public. I thought that was really helpful feedback, I think, and I appreciate your openness and honesty in terms of approaching and responding to the topic. I will just step back a little bit and say, you know, there are other efforts. Of course, the sheriff's department owns their data, I think, like Robin and sorry, and Darwin just mentioned, but there are, what we're having conversations countywide, and the sheriff's department actually is very, very actively involved in this discussion, right? So meaning that, you know, we are talking about how do we currently, or how do we look towards our current data? How do we look towards integration and have these conversations? So I'll just give you an example. And even though, and I apologize if I said it wrong, even though I'm saying, yes, this is going to take a while to figure out a system of governance and all this stuff, you know, we're not letting immediate priorities, you know, slow down or wait for this process to happen. One example, as I've talked to some of you, for example, is that behavioral health, the psych hospital has an electronic health record, and then the sheriff's department has their electronic health record. Currently, they do not talk to each other. They don't interface with each other. These are the two biggest electronic health records in the county, and they don't talk to each other. And so can we build an interface and you know, so that way some of that information, whatever is most useful, for example, for a sheriff's department nurse doing intake, to know, you know, that they will be at their fingertips, and vice versa, because unfortunately there is a lot of overlap. Right. So, we're having some of those discussions now, regardless, in terms of that type of data sharing. But Tim, in terms of your question, in terms of, like, you know, how can we look at statistics, et cetera, that is probably a longer term question. You know, we at least outside of the sheriff's department, you know, we don't have that data immediately available, but I think across the spectrum, across the sequential intercept model, we would like to know, how, just whether it's probation related data, sheriff's related data, health and human services data, how things are going, and how do we build the infrastructure, how do we build the ability to do a dashboard, but that will take some time to figure out what we need and how to get that done in a manner that works for everyone and respects the privacy rules and regulations, et cetera. But I just want to be very clear that there are some immediate things that we are trying to tackle, right now, because we know and realize the urgency of the need, for example, for sheriff's department to know, behavioral health related data from the psych hospital, and hopefully even more behavioral health organizations, not just the psych hospital.
Thank you. Dr. Brown, do you have a question for Dr. Sion?
Yes, first of all, I'd like to thank Dr. Sayon and Sarah for coming out tonight, sharing this with us. And I've spoken to people in the sheriff's department, and I agree with the family members. I know there are laws out there that prevent the sheriff department. There's privacy laws, but isn't there any kind of way that we can bypass this, or look at ways to streamline this process so that we can at least with the sheriff department, someone to be communicating with the family as much as possible, um, and just say, maybe we can get something signed saying that, but we want to make sure we get to the families with as much information as possible, because there may be something that we're missing out on or don't know. That this is just from a clear perspective. I hear the families, and it seems like they just want to know what's going on with their loved ones, why things are happening. And I've spoken to the people in the sheriff's department, and they say they want to give the information. They don't have a problem with giving it, but there are laws and restrictions that provide them from saying or providing all the things they want to say. So I'm sort of caught in the middle. Could we look at some kind of process, some kind of expedited process of bringing not only the sheriff and the county together, but the families to try to get this resolved? Again, I appreciate the effort, all the work that you're doing. Maybe it needs more people. Maybe we need to bring in some people like uh, 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 the people from North County and some of the families, some of their advocates, just so we know. Because I don't think that it appears to the families that there's something that we're trying someone is trying to hide something from them, and we as an organization know that we have to be seamless. So can you help us with that, kind of figure out how to expedite getting this information and bringing everybody on board and including everyone in, as much as possible in the process, and look at the things that are preventing that, and trying to do away with them, or let the family know at least, hey, these are the challenges that we're having. I want to do this. I want to find out some way of, I don't know, I don't have the answer, but privately just getting some information to them and keeping them updated on what's going on with them without anyone getting in trouble.
I can speak for the public safety group because I'm, working in our office that's working on, both the alternatives to incarceration and this much broader effort, as Sayon said. So one, I'm not sure what, I haven't attended a CLERB in a while. So Cherie or Paul, let me know if there's a different mechanism that you follow with your board, but I can certainly take this feedback back to our office and pass along that request for that specific kind of families need this information. They've been told that, there's a privacy concern. And one, I can report that came out of this meeting, but two, looking at, so I will do that. And you can follow up with me too. I'm Sarah Gordon at sdcounty.ca.gov. And then secondly, just in this project, I mean, we had a sweeping, basically the board office said, today there's no central overseeing what we're doing with data. We don't have a central way of looking at how we match data, but it is really broad. So just your comment alone there made me realize that when we're talking about who do you need to coordinate care with, I mean, families weren't explicitly named in this board letter, but part of what we're trying to do is we're trying to go to different groups and get a sense of when we talk about data sharing and when we talk about, what are the rules guiding, how we can share data, we've got to get the feedback from various, really important concerned stakeholders about where we even start. So in terms of this project, we're looking at what are the privacy laws that guide data release, and we will also put this as part of our project. What are these privacy laws regarding data release, and how is a family one of the entities that data needs to be shared with? So we'll definitely, Sayon and I, as touch points to this project, I think that's a really interesting point. We haven't heard anywhere else. And I think we'll probably if CLERB requests, we come back to, as we get, further along in this project and we're saying, what do we mean by data sharing? What are the questions we want to ask? What are the capabilities different community groups want? We can come back to and take that input, again, as we get further along in the plan about what do we even mean by where we need to share data, who needs to have it, for what purposes.
I would just like to add that I've been exploring this, and I know that there are federal laws that guide things for law enforcement organizations. There are state laws that say how they can handle things. And if we can find a way to help the people who are in charge of it understand that we're dealing with families, that not getting the families the information they need, that it's real problematic and it's causing a lot of pain, that would be fantastic. And if we could come up with and at least explain to the families what are all the laws and the things that are preventing all the sharing of the data they want, that would be helpful as well. Just list all the things that you'll have to go through to provide that. That would be fantastic. I think that's what you're saying, but I just want to make sure that's what I'm hearing.
Yeah,
Thank you, Sarah.
thank you, Dr. Brown, and thank you, Sarah. I just want to echo what Sarah said, and this is a use case, for example, and an absolutely important one that you're bringing up. So, and I do want to remind everyone that in one of my slides, I talked about how the board letter directs us to identify regulatory issues or political policy issues, you know, and we have to make recommendations. And so this, for example, could be one if we see that the state laws are too restrictive or the federal. I'm not saying that guarantees, you know, that will be changed, but you know, we could tell our politicians, our board of supervisors, and then they can decide whether they want to take further action, of course. But I will say in general, California's privacy laws are a little bit more restrictive, but the state is well aware of that. And they are, I know they're aware of that. And I believe that they're looking at that because they're having all this discussion around data sharing.
Thank you.
Thank you. Mr. Parker, I have a question for Dr. Sayone, but is there something you wanted to respond to that was mentioned before I do that?
Yeah, if you don't mind, Vice Chair Pintar, just it's basically to Dr. Brown's point, which ties into all of this. A couple of things, if I understood what Dr. Brown was saying, I would love for CLERB to have a mediation role. We do not. That's not part of our charter, unfortunately. And quite frankly, to some of the public comment folks, we are only as effective because we're advisory. We're only as effective as really the departments allow us to be with our recommendations for change. Now, prior to tonight, we've recommended over the last year and a half, 38. We've made 38 policy recommendations, and 20 of those pertain to death in custody. After tonight, we will have made 44 policy recommendations, 23 of those pertaining to deaths in custody. Out of the ones as far as families and communication, because I do think if the Sheriff's Department allows me to, you know, to have a mediation role, even though it's not in our charter, then great. Then we can have these families talking to folks. But prior to tonight, we've made recommendations for the department to unseal its death cases at the medical examiner's office. They implemented that. To update their family liaison program protocol, they've implemented that. We are asking tonight that they update and put a timeline on when families are notified when someone is transported to hospital with serious illness or injury or pending death. So these are things that we're trying to have that dialogue, that conversation between the department and the community the best that we can. But if we had a mediation role, that would be most helpful as well to hopefully allay some of the concerns and at least get people talking. So hopefully that's helpful to you, Vice Chair Pintar, and the members of the board.
Thank you, Paul. That's fantastic. And if we can't do it, someone in the county or some organization should be able to develop that for the family. I'm sorry I spoke without raising my hand. Anyway, I'll lower my hand.
Thank you. I just wanted to mention, I noticed on one of the slides that you said that part of this exercise would be to scan other jurisdictions, other counties, other departments for best practices. And this will come up a little bit later, item C, when Mr. Parker and I talk about what we learned at the NACOL conference. And one thing that I made note of is that the County of LA, I know you're talking about data sharing, but I think you're also talking a little bit about jurisdictional, overlay, right? Like what can the county departments, not just talking to each other, but how can they be helping each other? And the County of LA has their Department of Health, so their HHS, I guess the equivalent of our county health department, regularly inspect their incarceration facilities for hygiene, health and safety, food, diet, just basic hygiene in shower areas, things like that. Those are some of the complaints that we're hearing. Now, I know this isn't necessarily pertinent to the data collection that you're doing, but in terms of scanning best practices, I've always wondered why we don't have more of our county health department involved in providing oversight of healthcare in the jails. This came up last year or earlier this year even, when I was asking about vaccinations. Again, the Sheriff's Department will push back and tell us that we don't have jurisdiction over health and medical, which we don't, which is really tough. And I would, for members of the public and families that are here tonight. That's not something that we unfortunately have jurisdiction over. We're seeking it. But I would really encourage you to take a look at what LA County is doing. We have experts right here in the county, and to me, it doesn't make any sense to me that we're not using that expertise to improve conditions in the jails.
Thank you, Marianne. I would love to just learn a little bit more about the LA model. So I don't know if we could chat after, or if you have anything you can direct me to.
We can maybe see if we can find the right resource. But again, this was, provided at the NACOL conference, and maybe Paul can help us find the right way to connect.
Yeah, Vice Chair Pintar, I'll take care of that. Dr. T, I'll be back in touch with you in reference to that issue, no doubt.
Thank you very much, Dr. T and Sarah. If there's no other questions from members of the board, we'll move on to the next item. Appreciate you. We hope to hear back from you.
Thank you.
Next item, 4B, transgender incarcerated persons processes overview by the Sheriff's Department. Lieutenant Ophelia Rodriguez, are you here?
Hi,
There you are.
I am.
Hi.
Good
Okay.
evening. Good evening, everybody. I'm Lieutenant Ophelia Rodriguez. I'm here to present a short overview of our transgender procedures that we follow throughout all our detention facilities and our detentions bureau. Give me just a second so I can put the power screen up, the presentation up. All right, can everybody see my first slide?
I cannot. Can
I
anyone
can-
else see it?
No, I cannot either.
Okay, hold on.
Give us 1 second. We're getting the screen to come up. Just one more second.
Thank you, sir.
Okay. Cherie or Mr. Parker, would it make sense to move on to item C and come back when they have their slide presentation ready? That way they don't feel rushed and we can be efficient with our time.
I would like to do that if Ms. Hoffman's okay with that.
Yeah. Let's do that. And sorry, Ms. Hoffman, I calling you Parker's name. Okay. Paul, item 4C, you want us to kick us off and then I'll make some remarks?
Sure, I'll just do a real brief overview. Earlier this month, actually it was last month, Vice Chair Pintar and I attended the National Association of Civilian Oversight of Law Enforcement's annual conference that was held in Fort Worth. I think it was September 11th through the 15th. This was, I believe, I've been to a few of these conferences, and this was the most well-run, most informative thus far, in my opinion. The general concepts, I just want to tell you what they were basically talking about and some of the takeaways that I brought back. The main focus was on, just ironically enough, what everyone in the public is talking about tonight, what Dr. T was talking about. It's all about data. We now have an admin analyst, and we've never had one before. Naris Hakak is doing an awesome job already about working with our data. We have data, and as I mentioned to you folks before, we haven't made much use of it. We just started to do so with our 2021 annual report and our 2022 semi-annual report, where we specifically drilled down on the deaths in custody. There's much more data that we have that we'll be putting out next, at our next, full annual report for 2022. But we really, that's our focus, right? We have the information, we have the data that hopefully can assist the department, the sheriff's department and probation department, and this county, the board of supervisors and whatnot, to make informed decisions moving forward about the services provided by the sheriff's department, probation department. One of the things that's also was a priority, again, in public outreach, input from the public. I think that the public here on this call would admit that we are doing better than we used to. I think we're doing a lot of things better than we used to, but we could still do better. And so what we are doing, you'll see one of the policy recommendations we're making tonight is about increasing the ability of folks, or at least making a recommendation to the sheriff's department to increase the ability of folks to understand the services that are being provided in different languages and whatnot, and keeping in line with the county's threshold languages, which we'll talk about here in a little bit. De-escalation, one of the things that was very interesting to me, there was a big talk, it was talking about de-escalation, and I think all the members of the public and members of the board, the sheriff's department, we made a recommendation. They had a de-escalation policy that it said may, and we made a recommendation that they shall use de-escalation whenever possible, and they implemented that. What we learned was that there are several different de-escalation trainings out there, but the only one, according to the speakers there at this conference, the only one that has been scientifically proven to work is the ICAT de-escalation training, integrating communications, assessment, and tactics, developed by the Police Executive Research Forum. It's the only one. So what we will do, obviously, is ask the sheriff's department and the probation departments, which de-escalation training are they using? Is it ICAT or not? What is it? We'll talk more about that as we move forward. Implicit bias. There's been much discussion about implicit bias from members of the community that are on this call, members of the board. As you may remember, we've made recommendations about implicit bias to reduce bias and racially disparate practices. One of the things that we said, and it took some flack. One of the things we said, I think I said at a previous meeting, was when we made these recommendations that implicit bias training may not necessarily work. And so that was the gist, at least, of some of the speakers at this conference, was that implicit bias training does not have an immediate impact on police behavior. So I'm just telling you what was out there and what landed with me, and it kind of went along with what we had been recommending, that maybe it doesn't have that immediate impact. Okay, so the other things need to occur. But here's another big takeaway, and we have members of the public who are unhappy with us, and we have members of the public who think we're doing okay. But quite frankly, how effective are we? That's one of the things I came away with. How effective are we? What are we doing? And how do we gauge that? How do we say whether or not we're effective? It's interesting. Some agencies, some civilian oversight entities in this country use the sustained rate, right? Well, we sustained 50% of the allegations brought forward. I may upset some people here. I don't think that gauges effectiveness at all. I don't even. Is that the goal? Is the goal to sustain findings, or is the goal to search for facts? And wherever the facts lead us, that's the recommendation we make, and that's what we ask this board to do. So it's interesting because I'm not ashamed to put it out there, there was a big graph that was put out, had all these different law enforcement oversight entities in the country. And it had percentages of sustained cases. And one agency had 56% of its case. It didn't say cases or allegations. It just said sustained rate. One entity, civilian oversight entity, had almost 60% sustained rate. We This agency was way down toward the other end at 2%. But I don't know if that was allegations or cases. We had 527 allegations that we investigated in 2021, and we sustained findings in 10. So of course, that's going to be a low sustained rate. But if you want to look at cases, we made a sustained finding in about 17% of the cases, which would have put us more ahead of the middle of that chart. But to me, again, does it really mean anything? Is that how effective we are? I think it's probably more relevant how many policy and procedure recommendations not only do we make, but how many are implemented. I think that is a good gauge on effectiveness. It shows that whether or not the department, especially in an advisory role that we're in, whether or not they're willing to institute what we're recommending. I think that means something. But it also means something that whether or not this board is even willing to do that. And let's be honest, prior to a year and a half ago, like I said, after tonight, we'll have 44 recommendations in the last 22 months, unheard of. And over half of those, about half have been implemented. And many of those deal with deaths. So maybe that's how we gauge our effectiveness. I don't know. And I'd love to hear the public, right? And that's the other thing. I don't think I think we're getting public feedback, but I think if there's a way to solicit more input from the public on different topics, I think that's what we should be doing. Are we effective when people ask for us to come out and present? Is that a way to gauge effectiveness? That we're at least the word's getting out of who we are and people want us to come talk to them. Community attendance at our meetings. Criticism of us. I welcome the criticism because I will guarantee all of you on this call and in this room or whatever, that we are going to do everything we can within the purview of what our rules and regulations and the law is. And I think despite the naysayers, we are doing that for the most part. We are doing that. So I encourage the criticism because that leads us to continue to move forward. Kudos just leads us to be complacent. I learned that. So I welcome the criticism. Here's a major thing I learned, and I mentioned it before as part of the San Diegans for Justice report. They mention it. But there's a big push that civilian oversight entities receive 1% of the budget of the agencies that they provide oversight service to or for or about. So let's do the numbers. As of right now, my understanding is the Sheriff's Department's budget is $1.1 billion. The Probation Department's budget is $262 million. So we're looking at what's that? $1.4 billion. So if we do 1% budget, right, then ours should be like 14 million. Our budget is 1.8 million. So it's like 1/8 of maybe what the national trend should be to develop, to actually be serious and devote the resources to effectively provide oversight of law enforcement entities. One of the other things we learned, we've talked about Government Code 25303.7. We cited that code when we made the recommendation for us to respond to death scenes. We did. And that's a brand new law for sheriff oversight entities that they shall not obstruct, but they have the ability to do what we're doing. There's also a law, Government Code, brand new, that one reason for decertification of a peace officer would be failure to cooperate in a misconduct investigation. That includes over a civilian oversight entity as well, because it's a misconduct investigation. And then finally, one of the things that was a big deal at this year's conference was white supremacy in law enforcement. White supremacy in law enforcement. The Sheriff's Department and Probation Department have social media policies. But the question comes, do they review? Do they proactively review social media of their folks? I know that the state did an assessment of some 5 of the biggest agencies recently, and there was some disturbing content that was uncovered. So my hope is that the departments would be proactive in trying to root that out and doing social media reviews. And obviously, I know they do that in their backgrounds. But I hope that's a general. Those were the main takeaways I had from Nate Cole and things that I'm committed to moving forward, to propose to this board, to work with the Sheriff's Department. And that's with that, I'll turn it over to you, Vice Chair Pinto.
You touched the things that I had in my notes that were my takeaways, but I would just say another takeaway of mine is that in general, there were places and jurisdictions that had fewer, less ability to make change than we do, and some that had more ability. The city of Houston in particular was much more robust in the authorities that they had and their ability to get information from the departments and to have oversight. A couple of things, takeaways from that presentation in particular, just the presentation was called The Changing Landscape of Civilian Oversight. City of Houston has a dashboard that shows disciplinary action taken by the department once an oversight board determines a violation. I know that's something in our discussions as a board that we talk about all the time. If we sustain a finding and we think that there was wrongdoing, we never have really a sense of what happens next. The sheriff's department generally sends us a letter and says, we got your recommendation and we take it under advisement. I think it would be helpful to know what changes were made as a result of our decisions. In Houston, civilian oversight members are regularly invited to attend officer training and instruction programs. I believe the sheriff department has offered to have us participate, but I'd like to revisit that, and I think it's something we should do. Also, City of Houston said that as part of their oversight responsibilities, they have civilian staff assigned to review protests to ensure fair and equitable treatment. That seems like a good idea. I'd like for us to talk about that a little bit as well. They also have unfettered access to department data, to the department's database to see if officers have prior discipline complaints, maybe things that weren't filed through CLERB. I know that's probably something that would have to be part of the meet and confer, Mr. Parker, but I'm just mostly mentioning these things because there are some oversight boards that have a lot more ability to, enforce some of the recommendations that they're making, and they have more access to data and it may be a little bit more cooperation with their sheriff's departments. Finally, another big takeaway I had was just the impact that workforce challenges are having, in particular, into how incarcerated persons are cared for while they are in these facilities. Mandatory overtime among our sheriff's departments, law enforcement departments across the board. I believe our sheriff's department has mandatory overtime, and just the issue was raised that when people are having to work overtime and they're exhausted and it's causing stressors on their families, it makes it really tough for them to be able to provide the type of care that we would want in order to provide, a humane and safe environment in our jail facilities. Something to keep in mind. Again, it's a workforce issue that's across the economies, I think, but something we should be thinking about. Another thing that I learned, as you all know, I really was pushing hard on vaccination rates and making sure that incarcerated persons were offered a vaccine other than when they were first booked into custody. Pennsylvania, they offered incarcerated persons a credit for a facility credit. So we know in the jail facilities, at least when I visited, really important that people in these facilities have access to stores, things that they want to buy for themselves, whether it's hygiene products or extra food. So they were basically given a credit if they were willing to get a vaccine in order to encourage a vaccination rate. And they achieved a nearly 90% vaccination rate in their facilities with this offer. Finally, the last thing I would say is that the New York City Board of Corrections, which had a very big problem with jail deaths over the last several years, said that they insisted that their facilities had cameras everywhere and that cameras were operable. I feel like I was criticized sometime last year for pushing hard on the cameras by, I don't know, members of the public, members of this board, but I do think it's really important. And in New York City, they said it made a tremendous difference. So I would like to talk a little bit more about how we're doing with camera operability in our jail facilities.
Right.
That was my takeaways, were my takeaways.
Vice Chair Pintar, thank you. May I add something that I wanted to see if you were going to cover it. It should be noted, Many of the attendees, like 99% of the attendees, were from civilian oversight entities throughout the country, actually throughout the world. There were people there from all over the place, right? I met no one from law enforcement except 2 sheriff department representatives, our liaisons, Sergeants Tingley and Sergeant Cortez Garcia. They went, and not only did they go, they went with a week's notice, and their department backed and supported them going. And I think that needs to be mentioned because they were the only ones in the room. So thank you to the Sheriff's Department for making that happen. And that showed me that there's a commitment there. There's a commitment, and this agency and that agency. I mean, we have had our adversarial times, and we don't agree on everything, as we all know. But hey, the fact that they were there, I think, is a very good thing, and I think the public needs to know that.
Thank you for mentioning that, Mr. Parker. I appreciate it. Board member comment on that item, and then we'll go to Lieutenant Rodriguez. Mr. Parker, would you like to go to members of the public?
Sure.
I see 2.
I see 2 as well. Mr. Miller. Mr. Miller, are you there?
Yes, can you hear me?
Yes, we can.
Yusef Miller, North County Equity and Justice Coalition. Thank you for that summary and that breakdown. I think, like you said, it's hard to gauge effectiveness of entities such as this board. But one thing that really was a great first step is access for the community. As we remember back in 2020, when the North County Equity and Justice Coalition started the Saving Lives in Custody campaign, we had nowhere near this much community impact and this community access to put their grievances and speak out to this body. So I think that is a great first step, because if you hear as a sounding board what the community is frustrated at and damaged and hurt by, that we can make changes based on that is a great first step. That movement started with the case of Elisa Serna, and it's been going strong ever since 2020. So thank you for keeping the access to the community broad, so that we can come in and voice our complaints and speak truth to power. One of the things that will definitely increase the effectiveness is authority. The authority of the board for oversight of medical is a glaring issue that we need to take care of. There's a lot of recommendations that's been done already, but this one we really need to get a handle on so that we can have this authority. And when it comes to, I'm glad, well, without that, and it just becomes a recommendation to law enforcement, to the sheriff's department, it's just a check in the box. It's something they can do or not do. And that makes, sorry to put it this way, but it makes the board superfluous, that they could just make these recommendations and then they can say, okay, we take it under advisement and move on. If we like it, cool. If we don't, okay. So I think more authority and teeth in the board is very, very necessary. When it comes to white supremacy, under the Gore leadership, we met with Sheriff Gore, and we asked him directly, is there a policy that forbids membership to extreme groups? And he said, no, there's none. Not that he wasn't interested in it. He was saying it as a fact that that's just a matter of fact. We don't have something that says you cannot belong to an extreme group. And we were saying, maybe you should have this, because we were speaking about a lot extreme groups and white supremacy. So I think that's something we really need to look into as far as policy change, a statement that if this person is part of a white supremacist group, they can then say, well, I didn't break any rule, and then they would be right. And lastly, I would say intercoms and cameras are critical. Thank you for bringing that up again. That has always been something that we need to look into. The intercoms are broke. The audit report mentioned that. The intercoms are broke. There are dead spaces in video cameras. And for transparency and safety's sake, they need to be there. So thank you very much.
Thank you, Mr. Miller. Next, we will go to Debbie Eschbach. Ms. Eschbach?
Yes, hi, thank you. Mr. Parker, you asked for public feedback, so I agree that a good judge of your effectiveness is how many policy and recommendations that have been made that have been implemented. I think that is a good measure. And then it's unfortunate though that you guys only have an advisory role, so it would be great if you could get more presence there. And then Ms. Pinter, I agree as well with the cameras. I think that is probably critical in our justice. Thank you.
Thank you, Ms. Esbach. Thank you. Vice Chair Pintar, there are no other requests on that topic.
I don't see any other members of the public wishing to speak on that topic. I do see some board members. Mr. Ware?
Yes, man, that seemed like a great conference you guys attended. And I, for one, if there is a vote, that we take a very hard look as a board to what's happening in Houston. Sounds like a lot of the things that they have in place are areas that I would like to see us go from a county standpoint. And also the white supremacist piece, that was eye-opening to hear that in law enforcement. Not that it doesn't exist, but that it was addressed. And so, yeah, I would love to have some information on if we can get a list of what's happening in Houston. Then also the report, I think you mentioned, Vice Chair Pintar, the report of the information, the policy changes that are being made to the public, I think you said. Am I correct on that? So we can see what happened, what they did?
It was a dashboard that shows disciplinary action or follow-up from oversight board's decisions.
Is that was happening in Houston as well?
Mm-hmm.
Yeah, we need to get a list. I would love to get a list of what they're doing so we can look at those things.
I agree.
Thank you.
Maybe we can do that at a future meeting. Thank you. Dr. Brown, is your hand raised from before? Or?
Yes.
Okay,
No, yeah, I would like to piggyback on what Tim was just saying. Not only would we like to get a list of them, we like to get a know how they were able to bypass some of the statutes, like in HR. Most of you probably know that a lot of jurisdictions are not don't allow you to publicize when you take actions against an employee because of their privacy laws. So, in addition to getting a list of what happened, we want to find out how they were able to get it done and how they were able to negotiate certain laws and stuff that usually restrict organizations from getting that. And I love the use of technology in law enforcement because that can be leveraged to help where people need to have more people to protect or help other people, like in the jails. Finding out if there are other technologies that can be brought into play in addition to cameras that could help people, that can help them do a better job would be fantastic. And last but not least, I understand that there are a lot of, I'm not saying that I'm hearing and reading that there are a lot of jurisdictions, oversight communities are pushing to have oversight for almost every community and law enforcement agencies in those communities. And and they want to also try to make sure there's funding for that. So I don't know if that came up at the conference, but the 1% of a law enforcement budget, that sounds pretty good, Mr. Parker. So anyway, with that I'll yield back.
thank you, Mr. Brown. Mr. Parker, did you want to follow up?
Just simply in reference to the whole discipline, and as much as I think we would like to have that, California is a different animal, right? So as far as the laws that govern what's releasable from peace officer personnel records, I think it's going to take a legislative change to make anything like that occur. And I think I just want to just throw that out there so that nobody gets their hopes up that we can do anything specifically about that. If we're going to be looking at identification of folks and what the outcome of any kind of disciplinary actions.
Thank you, Mr. Parker. And I should have clarified, I think that they did say that their people's names were not attached to them. And yes, a different animal. I mostly just wanted to mention that there are places that are doing some really innovative things, and we can continue to push to do what we can do. I believe that was the end of board questions and comments, and we did members of the public. So we'll go back to item 4B. Lieutenant Rodriguez, we see your slide presentation. Are you ready to go?
Yes, ma'am. Thank you. I apologize for the technical difficulties in getting the presentation.
No
Up.
problem.
All right, so moving on, the transgender presentation is procedures that we follow within the Sheriff's Department and the Detentions Bureau. We're going to start with the beginning. As a person is arrested, and what booking facility would they be going to? So what jail does an arrestee go to if they identify as transgender, intersex, or non-binary? The arrestee should be taken to the facility that coincides with the arrestee's gender identity. So if an arrestee who identifies as being female, they should be taken to either the Las Colinas Detention Facility and Reentry Facility or the Vista Detention Facility. An arrestee who identifies as being male should be taken to San Diego Central Jail or the Vista Detention Facility. An arrestee who identifies as non-binary, the arresting officer should inquire as to whether the arrestee would prefer to be booked into a male or female facility, and then they transport accordingly. After that, once they reach the detention facility, the intake booking facilities, because the ones I mentioned are all intake booking facilities, they're going to go through a series of stations. Pre-intake booking process consists of several stations. The first one would be a pre-intake. This is where the detention processing technicians receive the intake slip from the arresting officer. They ensure that the charges meet the booking criteria and then assign a booking number and take the booking photo. After this station, they move on to the pre-intake medical station, and this is where the medical staff will medically assess the arrestee. The way they do that is by several things. So consists of medical questions in regards to their health, drug, and mental health history. They'll also take blood pressure and weight. At this point, one of the questions that they ask is to the arrestee is, do they identify as transgender? Depending on how they answer the response to this question, if they answer yes, then medical will immediately notify the jail population management unit. The jail population management staff will respond immediately to conduct an initial assessment with the individual prior to them continuing the intake process. At this pre-intake medical is also where they determine if the arrestee will be clear or not clear to be booked into jail. So the JPM initial transgender assessment during this interview is to determine the appropriate gender of the staff that will conduct the search. So the individual will be provided with a voluntary gender identity statement of preference form to document their gender identity, gender search, and housing preference. Once they determine their preference from the arrestee, the JPMU staff will immediately notify the intake staff of the individual's search preferences. And this is to make sure that the searches are conducted based on the individual's documented search preferences. After that, at some point, JPMU staff will enter a housing modifier into our jail information system of the individual search preferences. That way, other staff, when they look at the digital face card, they can see what the individual search preference is and then get the appropriate staff. After this initial assessment, they're going to move on to the pre-booking stage. At this stage, the detentions processing technician will enter charges, assign a bail, and then a court date is entered. Once this is completed, they move on to the intake portion of the pre-intake process. At this stage, the deputies working in that area will conduct a pat down and a body scan according to the search preference of the individual that they were told what their preferences were. A wristband will be placed on the wrist. The individuals will also be placed in holding to continue the intake booking process, which would be a fingerprinting, a second medical screening, and then a final booking. During this process, individuals that are identified as transgender will be kept separate from other individuals until the classification assessment is completed. Classification, when they get to the classification portion, the purpose of the classification system is to screen, assess, and house incarcerated persons in a manner that would protect the safety of the community, staff, and other incarcerated persons. The classification process consists of several components, including a custody assessment, interview by JPMU staff with the incarcerated person. Prior to the interview, the JPM staff will obtain and review critical information that comes from the current booking summary, from a complete criminal history, and also the interview questionnaire consists of several information gathering questions to assist in determining the custody custody level and housing. Then we move on to the classification housing plan. Incarcerated individuals will be housed according to their custody level in the following manner. Level 6s, these individuals will be housed individually in administrative separation unless otherwise approved by JPMU command. Level 4 and 5s, these individuals will be housed together. Level 1 through 3, these individuals will be housed together and eligible for a camp style facility. Incarcerated individuals requiring special housing, like administrative separation, protective custody, a medical or psychiatric, will be housed according to their special need. Housing assessment for the transgender, intersex, and non-binary. Individuals that do not specify a housing preference will receive a housing assignment consistent to their biological sex. Transgender individuals who state a housing preference, the housing assignment will be determined on a case-by-case basis, taking into consideration their preference, whether the placement would ensure the incarcerated person's safety, the safety of other incarcerated persons, and the safety of staff. Types of housing would be either a dorm style, or they can also be in a single cell. They may or may not have a roommate or cellmate. And if they do, and they're not a transgender or intersex or non-binary, then they would have to sign a compatibility form agreeing to them being cellmates. Currently, as of October 3rd, our transgender population by facility was, the total was 92 bureau-wide, and they're going to be between 3 different facilities: our Las Colinas facility, our Vista Detention Facility, and SDCJ. And as you can see by the numbers, Las Colinas has 24, Vista has 46, and SDCJ had 22. Now, our housing types, this is where you can see where our transgender population fall as far as, so by facility, SDCJ would have 2 administrative separation. There's 14 individuals there in protective custody, 2 in our jail-based competency treatment area, and 4 in our general population. At Vista, you see there's 5 administrative separations, 40 in protective custody, and 1 in general population. At our Las Colinas facility, there's 1 in administrative separation, 1 in protective custody, and 22 in general population. And that all equals out to our total of 92. So moving on to our Prison Rape Elimination Act, the Sheriff's Department has a 0 tolerance policy for all forms of sexual misconduct. Sexual misconduct includes but not limited to sexual abuse, sexual harassment between incarcerated persons, volunteers, contractors, sheriff's employees, and any outside source. The 0 tolerance policy, 0 tolerance of sexual misconduct applies to all our facilities and programs providing services to clients under the jurisdiction of the Sheriff's Department. All allegations of sexual misconduct will be investigated. Thank you.
Thank you, Lieutenant. We will go to members of the public who have questions or comments. I don't see any. Mr. Parker, do you see any?
There
Oh,
is
I see
one.
one. I
There
see
is
one
one.
now, yes.
Mi-
Mr. Myers. Now I see
mm,
two.
I'm looking for it. Hold on.
Mr. Myers, are you there?
Thank you. Can you hear me now?
We can hear you, sir. 3 minutes.
Yes.
Thank you. Thank you. Dave Myers here, lifelong resident in San Diego County, actually retired sheriff's commander, 33 years. I find the total population, the one chart that showed total population, they broke it down by admin seg, broke it down by which facility and general pop. And I find it very telling that in one facility, Vista, you have almost everybody in protective custody as opposed to other facilities. And so I wonder if the sheriff's department, the sheriff's person there could speak to the issue of why that is. Does it have to do with physical layout? Does it have to do with how staff maintains certain cells, whether it's dorm versus individual cells? But it is pretty telling that there seems to be a significant difference in housing of individuals, transgender individuals. And then again, for clarification, is that just self-reporting? Thank you.
Lieutenant, if you would like to respond, you may. If you don't have the answer right now, or that's up to you.
Sorry to jump in, just a reminder that this is public comment and not a question and answer. But of course, if any members of CLERB would like a question answered, they can ask that directly afterwards.
I'm sorry, Ms. Hoffman. I thought that we were supposed to allow them an opportunity, but we will move on to the next public comment then.
We're going to go to Mr. Miller, but I want to let everyone know my computer has elected to restart at this moment, and I have no choice but to allow it to do so. So I'm going to allow Mr. Miller to talk. It may take me a couple minutes to get back on, but hopefully somebody can run this in my absence, or at least wait for me to come back. My apologies, and my computer apologizes as well. Mr. Miller.
Yes, can you hear me?
Yes, we can.
You can.
Yusef Miller, North County Equity and Justice Coalition. I'm thankful that we are looking at this issue. A lot of people have been mishoused and misclassified, and it has led to near-death experiences. People have been beaten nearly to death. This is not fair, and it shouldn't be allowed. So this is a critical step in making sure that people are classified correctly. I think this is just as important to save lives as people being classified correctly as mental health, classified correctly as a drug addiction, and classified correctly as homelessness, because all of these, when it comes to intersection with law enforcement, has caused death. And in the mishousing of people in their identity has also caused very grave harm that almost included death. And probably just my knowledge is lacking to see that there probably are some people who actually lost their lives due to misclassification. But the only one I can recall now is the one who was beaten nearly to death because of being misclassified and mishoused. So thank you very much.
Thank you, Mr. Miller. I don't know if Mr. Parker's, somebody has some noise in the background. Can mute, please? Somebody has a radio or something on in the background, if they could mute, please. We'll go to board member comments and questions. Ms. Keen Ayub.
I think Dr. Brown was first, if you want to ask him first.
Okay, sorry, I saw you. Dr. Brown, questions or comments?
I have a question, and this is something that I don't know how to get my hands around this. Let's say, I'm just putting out an example here, and this is for the lieutenant. Maybe she can help me. What if the booking says that the person that is being brought in was abusive to women and was a sex offender or something like that to children, and requesting to be housed in a female associated with a transgender but female associate themselves with female? Do you just put them in what do you call it, isolation? And how do you protect them when they uh, uh, do they ever come out? In other words, just those are questions. How do you navigate those challenges? You don't have to answer now because you might not have all the, but that's just something that I've been wanting to know. If a person is, the booking thing shows something that's counter to how they classify themselves, how do you negotiate that? How do you navigate that challenge?
So if I have your question correct, you're saying if they come in and they're identifying as female and they have some charges regarding um, abuse of children
Or
or go ahead.
abuse of women or sexual assault, yeah, against women. How did you, and they prefer to be housed with the women. How do you navigate that? How do you,
Okay, yeah, again, everything's taken, it starts from the beginning. We're gonna have to run their current booking summary, what they're in there for. And then we do a complete check on their entire criminal history. And that's gonna take a few hours to do, because that we really can't tell who um who somebody is and what their criminal history is in the initial hour of them being in custody. That's going to come back once they get their fingerprints taken and we truly find out who they are. And then we'll review their criminal history and see what's there. Now those charges are concerning, and at that point the JPMU staff will do an interview after reviewing all their criminal history and gathering everything that we have if this person's been in custody before. um, and then they'll have an interview where they'll ask them a series of questions and determine what housing would be best for them. Again, it goes back to considering their safety, the safety of the other incarcerated people in our custody, and the safety of staff.
okay, thank you.
You're welcome.
Ms. Kina, you,
Thank you, Vice Chair. Lieutenant Rodriguez, I have a few questions, so I hope that you'll bear with me because I do want some clarification about, and I'm one of the ones that originally requested somebody to come. My original request was of the sheriff, and that was because the wording specifically in the policy that you placed on the screen, it said should. And my concern is if there is any kind of accountability for officers that do not handle what is in the best interests of the person that is being housed. We saw with one of the people that was taken in for a DUI that was simply a DUI, and they were placed into a cell with 3 other males, and they were beaten to a severity and then left there. So of course, accountability is a question that is going to come up, and then the amount of transgender people that are in general population, while not high, it only requires 1 death to be something that we need to address immediately. So that being said, I'd like to ask, 1, do you oversee and can you hold these officers accountable? This is, I'm trying to verify as to why they asked you to come and present this policy verbatim. And second, I'd like a response on Dave Meyer's questions. I don't know if you heard them or wrote them down, but I feel that maybe he could word them again and we could get some responses on that.
So I just want to make sure, as far as your first question, overseeing, you mean officers, arresting officers bringing somebody into custody, or do you meaning sheriff's department staff?
Officers that vary from the policy as stated.
Okay, so if an officer brings somebody into the intake facility and we later find out this person identifies as something different than the facility they came, again, the initial assessment will be done. And if we determine that once the housing assessment is assigned that they need to be transferred to a different facility, then that facility will transfer them accordingly. And then as far as the other questions, I didn't quite get all of them, other than I remember him asking about the increase of the protective custody, the amount at the one facility. There's only 3 facilities that we hold transgender individuals at this point, and that has to do with the shower area, so that when they do go and take a shower, they have privacy. Our George Bailey facility doesn't have like a door to where they can have some privacy when they're showering. So right now we're only limited to these 3 facilities. So we're because of the privacy in the showers.
Thank you. And is there consideration to alter the policy to ensure that officers that vary from it are held accountable?
When it comes to other agencies, that's going to be on the individual agencies to hold their individual officers accountable for not going by the policies that, you know, we ask of when they arrest a transgender individual and they give them a preference. For us, yes.
Thank you.
You're welcome.
Dr. Brown, your hand is still raised. Did you have
Oh,
another
I'm
question,
so
or
sorry.
was
Let me,
that-
I'm
That's
down,
okay.
I'm down. Thank you.
I just wanted to make sure you didn't have another question. I do not see any other board questions or comments. Am I correct? Okay, thank you so much, Lieutenant Rodriguez, for your presentation.
Are you welcome?
Okay, and we will.
Mr. Ware
I'm
has
sorry,
his hand
Mr.
up.
Ware. Mr. Ware, I'm sorry, I did not see you.
No, I just had a statement, a comment in that it doesn't matter the situation. All deputies or staff should be held accountable for any kind of violation, period. Doesn't matter what the violation is or who the people are. Everybody's held accountable and have consequences for those violations, correct? That's
Is
it.
that a question, Lieutenant, Mr. Ware, or is a statement?
That's just a statement.
Okay, thank you. Dr. Brown, is your hand up again? Dr. Brown, did you have another question or comment?
Oh, I was just piggybacking on Tim's statement, saying that I was pretty sure that they would be, I want to, I know why we do a lot of, we have a lot of concerns with the way things are happening in the jails, but I want to also thank them for their service. I know they, people are not perfect, and not everyone is bad. So I want to thank we're talking about 2,000 people or more, and they all, I'm sure there are a lot of good people that are working on our behalf and keeping us safe. And piggybacking on Tim's statement, Tim Ware's statement, that I hope that when a deputy or someone violates a policy or a procedure, that they're held accountable. I'm pretty sure that they are. That's all I'm saying. That's a statement.
Thank you, Dr. Brown. Ms. Kina, did you have another question or comment?
I did. It's specifically to the wording of the policy. I appreciate Mr. Ware's comment, because it does, if anybody violates the policy, they should be held accountable. Again, I want to reiterate that my concern in the policy is that it gives leeway to consider whether or not you're going to follow the policy. It says should instead of or I forgot how it is. It should be completely worded to state that they will follow the policy in the best interest of the safety of the person who are they booking into jail. And because the sheriffs oversee the jails, what's the best interest in where they are housed.
Thank you. Mr. Parker, we have a recommendation related recommendation that would change the verbiage to shall. Is that correct?
We do have that recommendation that's in front of the, that's in the Sheriff's Department's court as we speak.
Thank you for clarifying that. I thought that was important to remind folks of. Okay, we will move on to item 5A, overview of activities of CLERB executive officer and staff. And I think if it's okay, Ms. Hoffman, we discussed, we'll let Mr. Parker go through A through D and then go to public comment on any of those.
Yes, that's fine.
Okay, Mr. Parker.
Thank you, Vice Chair Pintar. I'll make this really quick. On October 6th, Chair Delaney, Vice Chair Pintar, Mr. Ware, and investigators Aldridge, Clue, Wigfall, our administrative analyst, Norris Hakak, and Lynn Setzler toured the San Diego County Medical Examiner's Office. Earlier today, I presented our CLERB 2021 annual report and 2022 semi-annual report to the Welcome Newcomers Network. In reference to attachment B, that's our workload and classification report for September. There were 13 new cases as compared to 18 last September, 8 cases on tonight's agenda. At the end of September, there were 92 active. Most of those, obviously, 83 were open and active, 7 were lodged, and 2 were still being told under POBAR. There were 32 open death cases, and we had documentation for 10 cases and awaiting documents on the remaining 22. There are 2 death cases on tonight's agenda. There were 2 new death cases in September, one at George Bailey and one at San Diego Central. There are 12 open uses of force resulting in great bodily injury, and two of those category of cases were reported in September. 4 open discharges of firearm without a complaint, and no open uses of force of protest or First Amendment protected events. As far as attachment C, that's where we show you, the board and the public, where we are exactly. It's broken down by 2. It's broken down by case number, but also by due date. And I encourage folks to look at the due date. At this time, we are much better off than we were at any point in our history, quite frankly, as far as not coming up on the deadlines. We have a couple, but that's nothing like we used to be. And with the addition of our most recent investigator, Spencer Clue, we are getting a handle now. We have a full full slate of investigators, and we're seeing what we can do with the number that we currently have. In reference to my correspondence to the full CLERB, we sent out, that's attachment D. There were a few media articles with 11 total articles. One of the articles, though, I think was very interesting. It was an article in reference to the governor signing a law that that jaywalking, unless it creates a public hazard, is no longer, as I think January 1st, will no longer be, I don't know what the wording is, but it's not going to be enforceable as it is now, which is very similar to the policy recommendation we did make to the Sheriff's Department to reduce racially disparate practices, to not enforce certain low-level offenses. And jaywalking was one of the ones we cited, unless, of course, it was a public safety concern. And now the governor is making that a law as of January 1st. The other email I sent was about the tour of the medical examiner's office, and then one in reference to the Sheriff's Department investigation of a San Diego Police Department in custody death from the other day. And I believe that would now make it 4 deaths, San Diego Police Department deaths that the Sheriff's Department is investigating pursuant to the MOU. And to be very clear, I had a member of the public, and it's one of the emails that I sent to the full CLERB, ask, well, what can CLERB do about those cases? And really all CLERB can do is if someone makes a complaint about the Sheriff's Department personnel investigating those incidents, well, then that would fall under our jurisdiction. I mean, it's part of the misconduct if it's a signed complaint, but otherwise that would fall under the San Diego City's civilian oversight entity. There are numerous policy recommendations pending responses. Many of those were provided to the Sheriff's Department fairly recently. I know that they're actively working on those responses to us. There's one response that we received, and that was from the probation department. We had made the recommendation for CLERB to be able to respond to scenes of deaths that occur of folks who are under the probation department's care or related to actions or activities of probation department sworn members. And as you can see, They have implemented, we have signed an MOU, just like we did with the Sheriff's Department. And I want to thank the Probation Department, our liaisons, Brian Berry, Brandon Abril, Ross Lewin, and then obviously Chief Probation, Irene Lilly, and also Chief Probation Officer Tamika Nelson for making this happen. This is a big deal. And I want to thank the Probation Department for its work on this. We're waiting for a couple of sustained finding responses, and then otherwise, that concludes my EO report.
Thank you, Mr. Parker. Are there members of the public? Yes, I see one, Mr. Miller. Mr. Parker, if you would like to allow Mr. Miller to speak.
Mr. Miller.
Yes, can you hear me?
Yes, sir.
Okay. Yusef Miller, the North County Equity and Justice Coalition. I would like to encourage the CLERB to keep on pushing for policy recommendations. We are definitely watching you. As you can see, all the public comments that come in, asking for reforms, asking for change. And as Mr. Parker said, that they put in a lot of recommendations. About half of them maybe has been accepted, but we need to keep on pushing as if this is the last hour. So thank you for that. And I also want to mention, I think we're coming down to the wire on this meeting, but last meeting we asked for a timeline on the scanning of the deputies and staff, and unless I missed it, we haven't seen anything back yet. It was supposed to come back this month. So I just wanted to bring our attention to the fact that it was supposed to be back this month. We haven't seen it. I'm eagerly awaiting that data. So keep pushing for the data, the policy recommendations. We thank you for it, and we need a bit more muscle on getting some of the critical stuff pushed, and we have your back on pushing those things to make sure we save lives in custody. Thank you.
Thank you, Mr. Miller. And then one other part of my executive officer report, Vice Chair Pintar, that I think should be, and Mr. Wilson's not here, but I'm saying this because I know he would ask if he was here. There are no investigations being conducted on the part of the police department about sheriff department related deaths. So I want to make that also very clear.
Okay. Thank you, Mr. Parker. Any board member comments or questions related to items 5A through E? I don't see any. We will move on to item 6, board chair's report. Ms. Delaney is not here tonight. She just asked me to pass along that she's sorry she couldn't make it tonight. She has a personal conflict. We will move on to new business, item 7A, continuance of teleconference meeting option pursuant to Government Code Section 54953E. Ms. Hoffman, do you want to read that one in for us?
Sure. If CLERB wishes to continue teleconferencing under this provision, the appropriate motion would be to find that CLERB has reconsidered the circumstances of the state of emergency and that state and local officials continue to recommend measures to promote social distancing.
Is there a motion from the board to continue with teleconferencing?
I'll make a motion.
Okay.
And I'll second it. Now second it.
I think I saw Ms. Keen first and Pastor Spriggs as a second.
Okay.
Okay. Either way, we got it done.
Yeah.
Do we need to call the roll, Mr. Parker? Yes, we do. Ms. Hoffman says yes. Go ahead.
Vice Chair Pintar.
Yes.
Pastor Spriggs.
Yes.
Dr. Brown.
Yes.
Ms. Keen-Ayub.
Yes.
Ms. Federico Mondragon.
Yes.
And Mr. Ware.
Yes.
Motion carries, Vice Chair Pintar.
Thank you. We'll move on to 7B, policy recommendation to the Sheriff's Department to log contraband searches of transportation vehicles. That was attachment F. Mr. Parker.
Thank you, Vice Chair Pintar. Real quickly, let me just bring this, make sure I get this up in front of me here. So what we're wanting to do is obviously this board has taken a very proactive role in looking at the Sheriff's Department policies as they pertain to searches. And because the sheriff and executive management have indicated that the illicit substances are getting into the facilities by primarily two primary methods, right? Incarcerated persons themselves and the mail. So we're looking at every policy that we can think to look at and to see if those policies, if any way, could be changed in some way or strengthened to possibly reduce those items getting into the facilities. Transportation, the vehicles that are used to transport incarcerated persons there is a policy clearly that indicates that those vehicles will be searched. The deputy transporting incarcerated persons will ensure a search of the incarcerated person, and the transportation vehicle is conducted before and after every transport. There's also a green sheet that indicates that it's the driver's responsibility to open and clear each compartment of the vehicle after each transportation and or movement of inmates. And the driver will be responsible for verifying their vehicle is cleared of any inmates and or contraband. So those policies exist, and we're very happy that they exist. The one thing that we're going to ask is that there be a documentation component to these searches. That does not exist right now. So we contend that if these recommendations, which would be to revise the policy and procedure to mandate the documentation of a transportation vehicle search before and after every transport, that's the first one. The second one would be to revise the green sheet to mandate that the driver open and clear each compartment of the transportation vehicle before, not just after, each transportation and or movement of incarcerated persons, and document the pre and post incarcerated person transportation and movement. Those two recommendations we would like to make to strengthen that policy and procedure, and hopefully with hopes to reduce these items getting into custody. Vice Chair Pintar.
Thank you, Mr. Parker. I do not see any questions or comments from members of the public. Questions or comments related to item 7B from the board. Mr. Ware.
Yes, I am continually amazed that we have to make these recommendations to the sheriff department. I don't know. It's so common sense. I don't understand why we have to do this. So that's my comment.
I think that means you support the recommendation. Pastor Spriggs, did you, I thought you had your hand raised. You did not. Okay. Any other, go ahead, Pastor Spriggs.
Yeah, one of the things that I did want to say publicly to the families that have lost their loved ones, I send my condolences to them, and I want them to know that when I became a board member a few years ago, it was my goal to help be a voice for the families. And so I just want them to know that we are being diligent in trying to come up with ways where they can get real answers. So I just wanted to publicly say that, and my condolences to those who have lost their loved ones.
Thank you, Pastor Spriggs. Do we have a motion from anyone on the board to support the policy recommendation in 7B? Pastor Spriggs? And Ms. Kina-Ayub as a second. Sorry, Tim, I got the others first. Mr. Parker, can you call the roll?
I can. Vice Chair Pintar.
Yes.
Pastor Spriggs.
Yes.
Dr. Brown.
Yes.
Ms. Kina-Ayub.
Yes.
Ms. Federico Mondragon.
Yes.
And Mr. Ware.
Yes.
Motion passes. Vice Chair Pintar.
Thank you. We'll move to 7C, policy recommendation to the Sheriff's Department, provision of eviction documentation in threshold languages. That's attachment G. Mr. Parker.
Thank you, Vice Chair Pintar. At last meeting, it was discussed, and I can't really get into the details, but because it was a closed session conversation, but from that led to a recommendation that perhaps we could make to provide eviction documentation in the county's threshold languages. Now, I know that the documentation that's provided to folks who are being evicted by the Sheriff's Department, I believe that comes from the courts. I'm not certain what other information is provided by the department, but it's our understanding that the department really doesn't provide much other information. And it certainly is not providing information in the county's threshold languages, which I believe, and Ms. Hoffman can correct me if I'm wrong, or Ms. Hakak, who has played a lead role with the county in a previous position in these languages and the interpretive services. So I believe there are 8, possibly 9, if you include American Sign Language, I believe. But the point is, all we're simply asking is that the department, when they go to carry an eviction, at minimum, provide some kind of documentation in that, that they possibly could utilize the interpretation services that are available. And there are certain attachments that are part of this, and they're all county generated. So really what we would like to do is that we would like the Sheriff's Department to create and provide an additional notice when posting or serving a notice to vacate to include a summary of interpretive services offered by the county. Again, there are many interpretive services provided by the county. And then also the notice should include information on how to access a summary of eviction timelines and processes translated in the 8 languages the County of San Diego has identified as having a substantial number of limited English-speaking persons. Those are the threshold languages. That's the recommendation that we're making. Special shout out to Investigator Clue, Spencer Clue, for running with this and drafting this and working with Norris Hakak to finalize this recommendation for the department. That'll be it, Vice Chair Pinto.
Thank you, Mr. Parker. I do not see any members of the public wishing to make a comment on this item. I have a question, but I'll go to Dr. Brown first. Dr. Brown, you have a question or comment?
It's actually not on this one, but I just remember something. I was remiss in not saying it. I believe the Sheriff's Department does have a policy against, it's called prohibited association, but maybe we can talk about that later, for sheriff members to join groups like skinheads and so. But I'll wait to Sergeant Tingley. But I just want to. It's been on my mind. I just want, but so I apologize for that. But I just want the group to know that I either heard of something like that or that I've come across it. So I think it's important.
Ms. Hoffman, thank you, Ms. Hoffman. Would that be something he could bring up with our liaison later, item 10? Okay, thank you. We'll come back to that, Dr. Brown.
Thank you.
My question, Mr. Parker, is, and sorry if this was in the backup and I missed it, does the county already have either contract staff or full-time staff that's providing interpretive services for those threshold languages?
What I'm going to do, and I don't mean to put her on the spot, but I'm going to ask Norris Hakak to address that question for you, since she's well versed in that. Norris, are you there?
I'm only asking the question because it shouldn't be a heavy lift if that's the case.
It should not be a heavy lift, but I'd like to have Norris opine.
Yes, thank you, Paul. Can everyone hear me?
We can.
Yeah, to answer your question, Vice Chair Pintar, yes, the county has 10 contracted service providers that went through the review with the prices and the quality, and those are approved by the county under the PPA, and anyone within the County of San Diego department can use them for interpretation and translation services with no charge for the customers who are requesting that specific service. And that includes also the American Sign Language too.
Thank you very much. Appreciate that. Seeing no other questions on this item, can we have a motion to support the recommendation? Or is there a motion on the recommendation, I should say?
So moved.
That was Dr. Brown, and a second. Mr. Ware, is that a second? Okay, so that was a motion by Dr. Brown and a second by Mr. Ware. Mr. Parker, can you call the roll, please?
Sure. Vice Chair Pintar?
Yes.
Pastor Spriggs,
Yes.
Dr. Brown,
Yes.
Ms. Kenayuk, Ms. Kenayuk.
Yes. Yes.
Ms. Federico Mondragon,
Yes.
and Mr. Ware.
Yes.
Motion carries.
Thank you. We'll move to item 7D, adoption of CLERB vision statement. That attachment came this afternoon. So if everyone hopefully had a chance to take a look at it. Mr. Parker.
And that attachment came very late, and that's on me. Basically, what I wanted to do with this is I want to advance us the best we can, right? We have a mission statement, and that mission statement for everyone in the room is to increase the public confidence in accountability of peace officers employed by the Sheriff's Department or Probation Department by conducting independent, thorough, timely, and impartial reviews of complaints of misconduct and deaths and other specified incidents arising out of or in connection with the actions of peace officers. But we don't have a vision statement. Like, yes, that's our mission, but really, vision statements are forward-looking, right? They really are the idealized state, and they also serve to ensure that everyone that's working at this board and serves on this board, but also the public, that they know what we believe and what we want to accomplish. So I think that that's what we need to do. I mean, we're at an interesting time in CLERB's history, and so I wanted to just propose. Perhaps if it should be something along the lines of to ensure that the Sheriff's Department and Probation Department provide fair, impartial, and compassionate services to the communities they serve and persons under their care. That would address all the contract cities, all the unincorporated areas, all the folks on probation, all the detention facilities, the folks in the custody of both probation and or sheriff. And really, because we're advisory only, and because we don't, we can't mandate anybody. I do believe we are here to assist those departments in providing the best possible service. That's what we're here to do. So I think that that's the vision statement I'd like to propose. I don't think that this is something that should be finalized tonight. I think that I would like your input, but I also think if there are members of the community, I think that they should be given an opportunity as well to opine. And then if we don't have anything, if it's something this board wants to move forward and adopt tonight, great. If not, if we want to think about it some more, get some community input, and maybe bring it back for next meeting, we can do that as well. And with that, Vice Chair Pintar, that's the rationale. That's what I proposed. Back to you.
If it's okay, I would like to recommend that we not take action on this tonight, because I would like members of the community, members of the public to have a chance to look at it and maybe come back to us with any comments if they would like to next month, if that's okay. Anyone object to that? I see a member of the public, Mr. Miller. I'm sorry, Paul, do you want to go to members of the public?
Sure. Mr. Miller, are you there?
Yes, I just want to say that's a great idea. I would welcome, and a lot of us would welcome the opportunity to participate. Thank you.
Thank you. Vice Chair Pintar.
Then I don't believe we need a motion. Is that correct, Ms. Hoffman, if we're just going to table it till next month?
Yeah, you're not continuing it. So yes, that's fine. No motion.
Okay, then we'll move on to 7E, adoption of a CLERB member code of conduct, attachment I. Mr. Parker?
Thank you, Vice Chair Pintar. I sent out this attachment today, and the Board of Supervisors, if I can find it here, just bear with me for a second. The Board of Supervisors approved this code of conduct specifically for boards, commissions, committees, planning, and sponsor groups. It was approved a week and a half ago at a Board of Supervisor meeting. So I want to just go over, I don't want to read to everybody. I know, we can all read, right? But basically the whole point is to create an environment in which we adhere to and pledge to uphold several values about what the board is about, serving the public interest. Our actions impact the community's trust in government as a whole. We commit to act with honesty and integrity. We commit to the vigilance in not having bias or conflict of interest, whether the conflict of interest is real or perceived, because we acknowledge that apparent conflicts of interest will corrode the public's trust in what we're doing. To be fair, to be impartial, active listeners, not act on our own personal agendas, affiliations, or biases. Diversity, to focus and acknowledge that diversity is a strength, commit to promoting an inclusive and welcoming culture at our meetings and with each other. Practice civility by fostering a professional environment, courteous, respectful of each other, of staff, of elected officials, of our complainants, of our members of the community, everybody that we come in contact with, even if we don't agree. We're committed to fostering an environment free of violence, discrimination, intimidation, harassment. We're committed to transparency, access to information, and promoting broad public engagement. I've also included policy A74, which is about the county boards that we must comply with as well. Now, what the Board of Supervisors said is this is the basic foundation that every board must adhere to. This is the code of conduct for every board. However, we can adopt additional standards of conduct. So what I chose to do was to look at NACOL's. They don't necessarily have a code of conduct. It's called something else, like a conflict. It's ethical document.
Ethics document,
Yeah. It doesn't necessarily say code of conduct, but what it had on there were some things that I think I would hope that this board would acknowledge should be part of our code of conduct, and that would be to maintain the confidentiality of the materials. That's huge. As a number one tenet of what we're doing here is for us to maintain the confidentiality. Number two, I think that we should somehow put in here about having open, candid, non-defensive dialogue with our stakeholders, whether they be Sheriff's Department, Probation Department, family members, community, media, doesn't matter. And also, I think that there should be something here about each member being willing to educate, but also learn from the community. I think that should be part of our code of conduct as well. So this is something else. If you folks want to discuss further, maybe not take the action tonight, but at least maybe think about it and we bring it back. Also, to get the community's input, if you so desire. These are things that are going to be our documents as we move forward, whether it's the vision and the county, the code of conduct. So I'll leave it up to you, Vice Chair Pintar, to move this forward however you and the board see fit.
Okay, I'll go to members of the public. I see one, Mr. Parker.
Bear with me here. Mr. Miller. Mr. Miller.
Yes, Yusef Miller, North County Equity and Justice Coalition. I like codes of conduct, so they're great, but I would be remiss if I didn't say that I challenge the Sheriff's Department with affiliation to extreme groups, and I wonder if you have this language in either somewhere in your documents. So thank you. That was all.
Very well. No other requests to speak, Vice Chair Pintar.
We'll go to board comments and questions. Ms. Kinayu.
I do apologize. I'm sorry about that. I would like to see if we could maybe table this and discuss it at a further time, only because there are a few things that I'd like to read about. I'm always cautious whenever there's a policy that states non-combative, and I'll tell you why. Women of color tend to be seen as combative, tend to be seen as a certain way simply when we discuss certain issues. And that's an issue that consistently comes up, and that's something that I feel like needs to be worded in a way that can be equitably located across the board. Policies tend to be weaponized against people of color all the time. So for me, it's something that if we're going to put verbiage in there, I want to make sure that it's something that's going to be equitably placed across the board to all the members.
Thank you. Dr. Brown?
Yeah, I was just responding to Mr. Miller's, I think that I believe it's called the prohibited association policy that I believe that's in the Sheriff's Department. And again, Mr. Sergeant Tingley could speak to that when we get to that. Thank you.
Thank you, Dr. Brown. If there is not a motion to proceed tonight, I believe we also do not need, unless anyone feels strongly that we need to move forward with this tonight. I don't think we need to a motion to adopt this at this time unless anyone feels otherwise. We've had one request from one board member to allow additional input. So if that's the case, we don't need to make a motion, correct, Ms. Hoffman? Okay, then we will revisit this next month and move on to 8A unfinished business, 8A update authority. Paul, if you want to just tackle both A and B.
Sure. No change. We're again, the county's legislative program we've put forth to ask that the county legislative program include the support of anything that comes across during this next legislative cycle that would increase the transparency of civilian oversight. So that's the first one. So that's where we are with that. Number two, medical service providers. We are, County Council has done great work on this. I think our next step is just to finalize a draft, some changes we're making, draft changes to the code, and then move forward. So hopefully next month we'll have some additional, I'll be able to report some additional progress. But that's where we are on both of those. Both of those things are still very important to me, and I know to this board and to the public.
Thank you, Mr. Parker. I don't see any members of the public wishing to comment on item 8. I do see Sergeant Tingley's hand raised. Did I miss you at the previous item, or did you have a comment or question, or maybe a response?
If they wanted me to respond to the policy that the San Diego Sheriff's Department has in regards to associations 2.9, I'm free to do that if you'd like that.
Ms. Hoffman, should we have that? Let's leave that.
Or I can do it. Or I can do it next month if you would like. That's perfectly fine. Either way.
I think I'd be happy to hear the response. I was thinking maybe we would take that up under number 10, if that's okay.
That's fine.
Okay. Board member comments. Does any member of the board have a comment?
I do.
Yes, Mr. Ware.
I just want to say, the visit to the medical examiner's office, it was awesome seeing my fellow board members in person. I really enjoyed that.
I enjoyed it as well, Mr. Ware. I also participated in the medical examiner's visit along with our fellow board members from the city of San Diego. Just one takeaway I would like to mention is that as we're seeing across every sector of the economy, including the sheriff's department, understaffed. They are very short-staffed at the medical examiner's office. I did hear a member of the public make a comment about the delays for their loved one's autopsy, which I'm very sorry to hear that. And I just wanted to say that I know that they're they have a lot to do. And we had, according to the medical examiner, the report that he gave us, there were 1,500 additional deaths across the county that they were responsible for last year. And I asked if that was COVID related, and the answer is no, because they don't generally perform autopsies that are for people that have passed away in a hospital. But it seems to be a lot drug related. A lot of overdoses, unfortunately, and a lot related to fentanyl, which I thought was relevant to some of the cases that we're seeing. Anything else from board members? I don't see anything else. Okay, we'll go to number 10, Sheriff Probation Liaison Query. Sergeant Tingley, you want to go ahead and respond to Dr. Brown's question?
So according to 2.9 within our policy and procedure sections, it covers associations, and it states employees shall not associate on either a personal or business basis or have dealings with persons whom they know or should know or have reason to believe are or have been racketeers, sexual offenders, drug dealers, illegal drug users, illegal gamblers, persons whom the employee suspects or should suspect are involved in felonious activities, convicted felons, persons held in county custody, felons serving or who have served time in custody, or persons under criminal investigation or indictment, except as necessary to the performance of official duties or where unavoidable because of other personal relationships. So that's what 2.9 of our policy and procedure sections, according to association, states.
Ms. Kian Ayub? And then Dr. Brown.
So Sergeant Tingley, just to verify, that does not state in any way, shape, or form that officers are prohibited from interacting with white supremacists. Is that correct?
That section in itself does not, no.
Okay.
Mr. Brown? I'm sorry, Dr. Brown.
How difficult would it be to add that, Sergeant Tingley?
Well, that would have to.
I was under the impression that it would, all this felonious, I was thinking that those kind of groups were participating in that kind of activity is felonious. So how do we need to be specific then and add racist groups, groups of violence or what have you? What would you what would you suggest we recommend us? Is that something we should do here at CLERB and get back to him?
Well, I think that if it's a policy recommendation from CLERB, then that would go through Mr. Paul, then it would come to the department and we would send it up the chain of command, if that's your wishes.
I'll defer to Paul. I'll defer to Paul.
Mr. Parker, it sounds like that would have to be a recommendation from CLERB for them to make that change because it's not covered in the section that Sergeant Tingley just read.
Now I can research in more detail and get back to you and make sure that it's not in another section that I'm just overlooking, but that's the section that I currently found. So why don't we do this? Why don't we let me just do a little more research, because I was kind of put on the spot with this one. It wasn't something that was going to be asked. So let me do a little more research on this. And if I cannot find it anywhere, I'll let Paul know. But if I do, I will send him the section so that you're all clear on it.
Okay, thank you.
And if Sergeant Tingley gets back to me over the next couple of weeks, if we have that conversation, if it's not there, then we'll have something on, we'll draft something and have it before this board.
Mr. Ware?
No, I was just going to ask Sergeant Tingley, can you also research what would be the standard to determine a group is violent? What would be the qualifications?
Yes, I can.
Obviously, we know about the white supremacists, but I'm sure there are probably other groups as well that people would say are violent that we may not agree with. What's the standard?
All right, I can look into that. That's not an issue whatsoever, sir. I'll look into that.
Dr. Brown, did you have another comment or question?
Yeah, Sergeant Stingley, and I'm hoping that it's not something like there are good people on both sides.
Okay, Ms. Kina, you?
Paul, would we need to make a motion on what would be drafted if it's not found? Or would we need to wait to see what is located in the additional?
I would think, if it's okay, Ms. Hoffman and Vice Chair Pintar, I would think, let's see what Sergeant Tingley gets back to me. Allow me to draft something, and then you folks could look at it. It's just a draft. And if you wanted something different after I propose it to you, then we could talk about it at the next board meeting, and you can tell me how you want that draft verbiage finalized so we can put it forward to the department at that time. Does that help?
It does. I just feel like there should be very specific, or at least very, very specific terms that states that anything that is anti-Black, anti-Brown, anti-API, anti-LGBTQ should not be something that an officer should be a part of, especially when they're dealing with the public on a daily basis.
Very well. Like I said, I'll wait for him to get back to me. We'll talk it through. I'll put something in writing, and you folks, can have that draft and I'll get that draft to you much sooner than I got the other attachments to you today.
Mr. Ware, did you have another question or comment?
I was just going to say, we just have to be prepared for this. It could be a possible slippery slope on situations like this, because now you're going to open it up to motorcycle gangs and everything else. But I'm good to go with it.
Actually, I wanted to make a comment to that, Mr. Ware, and suggest Mr. Parker or Sergeant Tingley. I'm fairly certain that the FBI has groups that they consider hate groups, extremist groups, that they might have a pretty clear definition that we could follow. I know groups like the Southern Poverty Law Center has classifications of hate groups, extremist groups, but if you wanted to go with a law enforcement agency, I feel certain that the FBI might have standards already that maybe we could use for reference.
Thank you.
But, okay, thank you. Seeing no other comments or questions, we will move on to, I guess need to be read into closed session. We are finished with the open session agenda. Ms.
Pursuant-
Hoffman?
Well, I was thinking, I thought that the fantastic Ms. Hoffman had a comment. I can see it on her look. On her face, she was going to make a brilliant comment.
If you were going to continue discussion on the on that item, I was going to suggest that it be agendized for a future meeting. But it seemed like that was the end of it. So thank you. Pursuant to Government Code Section 54957, this board will convene into closed session to consider item 11 on tonight's agenda.
Okay, thank you to everyone, members of the public that participated tonight, and I will see the rest of you in closed session.
Are we starting now?
Oh, we should
Closed
set
session.
that. Does anyone want to break 5-10 minutes? How much time? 5 minutes. Okay, see you at 8:30.